COVID relief grant funds through the State Office of Community Renewal, and a public hearing is required for citizen participation in the planning and design of the application. So there are certain portions of the public hearing notice that I'll need to read just to make it formally considered a public hearing, and then if there are any comments from the public, we'll take those for the minutes that we have here. So the New York State Housing Trust Fund Corporation has announced the availability of approximately $60 million of federal funds for New York State Community Development Block Grant funding for CDBG COVID-19 response, or CDBG-CV is the term they're using. So what the county intends to do is to apply for $580,000 in the CDBG funding to assist up to 10 renters or single-family homeowners to help with repairs or upgrades to improving the overall health and safety of housing. The county also anticipates that the CDBG-CV COVID-19 funds may be used as leverage to complete rehabilitation on units previously approved for participation in the county's ongoing HUD-funded lead-based paint hazard reduction program. And this is a county-wide program, so it's eligible to anyone in the county. There are certain eligibility requirements, however. There is an income requirement. Individuals or households need to earn less than 80% of the county's median household income limit. And individuals also need to own their home or rent from a landlord who's willing to participate in the program particulars. It is the application is due the end of the month, end of August, and awards are expected within 90 days of the application, and then there's a year to complete the project. Some just more formal notices that I have to read out here. There is the county does maintain an anti-displacement and relocation plan for its housing activities. Should there be a necessity to relocate someone during the rehabilitation work, we have a process in place to do that. There's a fair housing statement that's required. The County of St. Lawrence is an equal opportunity housing provider. The county and its subrecipient do not discriminate against applicants for housing assistance based on their race, color, religion, national origin, age, gender, familial status, or disability. And the last item that I need to make note of is that written comments on the application may be submitted to myself, Jason Folkenhauer, Director of Planning, by mail at 48 Court Street, Canton, New York, 13617, or by email at jpfotenhaudr@stlawco.org, and we can accept those comments until the 13th of August, next Friday. Excuse me, this Friday. And that's all I have to do for the formal hearing notice. And happy to answer any questions on this project or anything else.
You said it was 580,000 for 10 houses.
Correct.
58,000. Limited 58,000.
No, that's just an average that we put together based on past history experience. So some houses will get a little bit more, some will get a little bit less. But that's the general.
You work off the existing applications that are already in there.
Exactly. So the existing list or the housing, we do want to couple this with a lead program. So if there is some higher cost lead houses out there, we can draw some of this money to help pay for this higher cost project.
What is the median income?
Median income in the county is based on household size. So family of four, 80% of the median is 55,500. So that's what you need to be eligible for a family of four to have income under that.
And relocation costs.
Yes. Yeah, usually motels, or if there's other family that can who want to work with the rarely do we have to do this, but if something were to come up where something were to be extended, and we had to come up with either paper or hotels or.
Jason, that 55,500, is that based on 2 parents?
That's household income.
This household?
Yeah, household income. So it's based on maybe more than just there are 3 adults working. We would average out however many adults for the household.
Yes, Mr. Burke, did you say what the average household income was?
Yeah, I know what the 80% of the median. I do some quick math here, but for a household of 4, 55,500 is the cutoff, is the eligibility.
That's for eligibility.
Correct. Yeah. For a household of 4. For a household of 1, it's 38,850.
I thought the statistics, I thought it was 44, 45,000 household income in St. Louis.
Right, for an individual. Yeah.
No, household.
Oh, for a household.
Household.
For a household, it could be a household of 1. So it might be 45,000 for a household of 1. I can look those numbers up.
Any other comments from the board? I don't see anyone here from the general public that wants to ask questions or make comments. I suppose we should let this meeting close. There's nothing here to make any suggestions or any questions. So I'll leave the board on. Close.
Thank you very much.
The Monday, August 9th meeting of the Services Committee of St. Lawrence County Board of Legislators. I would entertain a motion to approve the agenda by Mr. Ganesha, seconded by Mr. Curran. Any discussion? Seeing none, all in favor? Aye. Opposed? Carried. I'd entertain a motion to approve the meetings of our July 19th meeting by Ms. Biacco, seconded by Mr. Sheridan. Discussion? Seeing none, all in favor? Aye. Opposed? Carried. Start off with the COVID update by Dr. Williams and Julie Monk.
Hello. Go ahead and share my screen.
Go right ahead, Julie, if you're number 1.
All right. Get my screen ready. Maybe. Okay. So as of today, we have 7,749 cases to date. We have 7 current hospitalizations. There's 88 active cases and 7,564 have completed isolation. For our daily hospitalizations, like I said, we do have 7 today. This is the most that we've had hospitalized since June 15th. For our weekly cases, today I had our highest day. Unfortunately, we had 24 new cases today. So for this week, with 1 day remaining, we're at 77 cases, and that's the highest that we've had since the April time period. The average new daily cases per week, and that's still with 1 day left, we're at 12.83. The last couple of weeks, we were at 6 new cases. And then as you can see, for a while, we were averaging 1 to 2 cases. So it's starting to pick, unfortunately, back up in our county. For weekly school cases, we've had 6 cases so far for the month of August. And the way we're counting cases for schools is if they are a teacher, staff, faculty, and or taking summer school. Those are who are counted for school cases right now. We're not just counting students that aren't in school. And that will go back to counting all students once the school starts up in September. For the colleges, we have had 3 cases in the college, and the colleges are all getting set to return this month, at some point this month. So we are hoping, though, that they've done a really good job of promoting vaccinations. So we're hoping that the cases stay a little bit lower. So for the isolation and quarantine total numbers, as I said, we had 88 in isolation, and then we have 130 people that are actively on quarantine. So we've monitored a total of 36,006 people. So for our public health department, we have administered 5,962 first doses. We've done 4,985 second doses. So during the month of August, every Monday and Wednesday from 8:30 to 2:30, we are doing Pfizer at our clinic. This week we're doing second doses, and I have the dates of the first doses that we did it, but our second doses are this week. So Edwards is tomorrow and Ogdensburg is on Thursday at the farmers market. And then in partnership with the Community Health Center, 54 doses of Pfizer and Johnson & Johnson were provided at the Governor Fair. We are offering vaccination on site. So if you're an employer with a minimum of 6 individuals and you like public health to come on site, just call our office at 229-3407, and Janesse Watson will be able to help coordinate that. So guidance for the K-12 schools came out in July, and then they did, from the CDC, and they did an update on August 5th. New York State has decided that they are not going to be putting out official guidance and are leaving it up to the local school districts. So in consultation with the local health departments. So per the CDC mandate, masks are still required on public transit. So that does include school buses. And then we are recommending that schools put all of the guidance into place from the CDC, as layering the prevention strategies are the most effective way to stop the spread of COVID. And these recommendations include vaccination, and I bolded that because that's the best recommendation right now. And then wearing a mask by all individuals while indoors, having at least 3 feet between students and 6 feet between adults and students, doing screening testing, having increased ventilation, encouraging hand washing, staying home when sick and getting tested, contact tracing with quarantine and isolation, and then cleaning and disinfecting. And we are actively working with all of the schools to make sure that we are getting the best plan in place for each school district. So transmission in St. Lawrence County, I know this has been a big thing with a lot of the counties in the state going to substantial or high. We are still moderate as of today. And the time period, though, as you can see that the CDC uses, it's delayed by a couple of days. We expect to be in an area of substantial transmission this week with our 24 cases today. We're at 46 per 100,000 cases for a 7-day rolling count. So with our case count today, it'll put us over into that substantial once today's data gets caught up into the 7-day count. So the CDC does recommend that once your county or your area is in a substantial or high transmission rate, that people do wear masks in indoor settings, regardless of vaccination status. So in order to get messaging out there, these are some of the messaging that has been put on our Facebook page. A lot of it is, concerned about the Delta variant, who needs to wear a mask, and the fact that COVID is more infectious than other viruses. Dr. Williams is going to be going over the Delta variant in more detail. I just wanted to show some of the things that are on our Facebook page for messaging to the public. And then, so who still has to quarantine? So there are no longer exceptions for essential workers. That was part of an executive, one of the executive orders under the state of emergency. So when that ended, the essential worker status went away. So if you are an employer or employee at a business that was deemed essential under the executive order, you should be reviewing your quarantine leave process, because we will not be granting exemptions for being essential anymore. So the only way to get out of quarantine is to be fully vaccinated. So individuals who are not fully vaccinated or have not recovered from COVID in the previous 3 months still have to quarantine. Anybody with symptoms following an exposure. And a new addition to the CDC guidance is that you don't have to, fully vaccinated people with no symptoms do not have to quarantine, but they should be tested 3 to 5 days after exposure. And while waiting for a test result, those individuals should be wearing a mask while indoors. And if they opt to not do the test, then the individuals should wear a mask indoors for 14 days. And one of the questions that we have been fielding a lot is traveling to Canada, because that opens today to go there. So to go to Canada, you have to be fully vaccinated. You need to have a negative PCR test within 72 hours. And then you have to download and fill out the Arrive Can app. It's the Canadian version. That has to all be done within 72 hours. The fully vaccination is the 2 weeks, but you cannot upload your data until it's within 72 hours of your trip to Canada. And then there is no requirement to test when coming back to the United States, but it is recommended after an extended stay. And then just a reminder that August is National Immunization Month. So it's a great time to be reminding people that, along with trying to do the COVID vaccination, but along with trying to get the schools reopened. If you have kids, call your child's pediatrician or public health to schedule an appointment to ensure your child does not become excluded from school. And with the rise in cases, expect more people to be utilizing primary care and plan accordingly so your child does not end up on that exclusion list. So if you're unsure if your child needs any immunization, you can give us a call to go over existing health records. And that is all I have. So I'm going to turn it over to Dr. Williams.
Any questions for Jolene? Seeing none, Dr. Williams, go ahead.
Good evening. So as usual, I wanted to just start by kind of reviewing what's happening on a national level, since that usually impacts what happens locally. So if you look at the United States and you look at new COVID cases and trends, we have this unfortunate, fairly significant uptick in cases over the past month or so. If you look at how these trends go kind of across the board, for cases, for hospitalizations, and for deaths, there's been a significant increase at these 14-day measurements. If you look at the geography, this is a map that's put out by the CDC that demonstrates where there are the greatest number of cases per 100,000 individuals. The pale green and the lighter green are the lower transmission areas. The darker color, darker blue, represent high transmission areas. And if you correlate that with vaccination patterns, what you see is that the states, especially the states that have the less than 40% vaccination rates, tend to have the high concentrations of COVID. The Delta variant, which Jolene mentioned with the graphics, is now the dominant variant or strain of COVID throughout the United States. As of data that was available from July 31st, it represents more than 83% of COVID cases. Based on its rate of growth percentage-wise, I would expect that even by this week, it's 90% or greater. One of the concerns with this variant is it may be more deadly. We know that it is more likely to cause severe disease. There was a study published by the United Kingdom that talked about a doubling of the risk of hospitalization. It's probably associated with an increased risk of breakthrough cases, and I'm going to talk about breakthrough cases in further detail. It's more contagious, and this is maybe the most concerning feature. So some data, preliminary data, is talking about that the viral load, so the amount of virus that can be identified in people, is like 1,000 times greater than alpha, which was the strain that was present earlier in the year. This is a graphic that sort of describes both how deadly a virus is. So this axis looks at the fatality rate of different illnesses, and this axis looks at the how contagious something is. And if you look, the original version of the coronavirus was over here. And compared to the seasonal flu, the original version, as we know, was both more contagious with a R value of 2.8. So that means that for every one person with the original coronavirus, we expected they might end up giving it to 2.8 other people. In comparison, the Delta variant is now further on this graph. It's both higher on the y-axis, so it's, as I said, probably more deadly, but it's more contagious. And when you compare it to chickenpox, which is very contagious, the Delta variant is pretty similar, and the R value is probably going to come out somewhere around 7. One of the issues with the Delta variant is probably an increased tendency to cause breakthrough infections. So these are infections that occur in fully vaccinated people. And this is the study that, or the case report that the CDC put out that modified that led to the modification in recommendations about masking. And what they looked at is there was a large gathering in Cape Cod, Massachusetts. And despite a fairly high vaccination rate, they had a number of people with COVID. Now, most of the people didn't become very ill because they were vaccinated, and there were very few hospitalizations, and there were no deaths. But when they did the analysis of the specimens of the people they were able to do the analysis on, 90% of the cases were from Delta. So again, just demonstrating that Delta is more likely to have breakthrough. So when you talk about breakthrough cases, I think it's important to put things in perspective. So there was an analysis that was put out by the Kaiser Family Foundation from just the end of July. There's only 25 states that report on breakthrough cases. Unfortunately, New York State is not one of them. But of the states that do report, what you find is that for vaccinated individuals, this column, these percentages, are the overall cases among fully vaccinated individuals. And what you see is that it's about less than 2% of the total cases are in vaccinated people. And on the contrary, for people who are not fully vaccinated, they represent more than 95% of the cases that we see. So as far as vaccination and breakthrough cases, the bottom line is that more than 95% of the cases are in unvaccinated people. More than 99% of the deaths are in unvaccinated people. And more than 99% of the hospitalizations are in unvaccinated people. Flipping that around, if you are vaccinated, your risk of death is decreased by 25 times. So this just puts things in perspective about vaccination and breakthrough cases. I did also want to just quickly illustrate sort of a real world example of what happens with vaccination throughout a community. So if you look at what happened in India this past year, they had their initial wave of infection, which was probably the Alpha variant. Then they had, in the past few months, this very large wave of Delta. Now, one interesting thing, which is room for optimism, is their Delta wave, even though they didn't really put any meaningful public health interventions in, their Delta surge only lasted for a few months, a few deadly months, but at least it passed seemingly on its own. The unfortunate thing is that when they had their first wave of Alpha, they had a number of deaths. When they had the wave of Delta, they had a substantial number of deaths. It's probably underreported, but they had a lot of people die. The vaccination rate, if you look it up as of today in India, of fully vaccinated people is 8.1%. And I think this is why they had such a high fatality rate, among some other reasons. If you look at the United Kingdom, if you look at cases, they had their first wave or second wave, then they had their Delta wave. But unlike what you saw in India,
I heard it a couple times now.
The Alpha wave that they had deaths, but for the Delta wave, which they're currently having, because their vaccination rate is around 60%, you really don't see an increase in deaths. So this is just a real world example of what probably happens when you successfully vaccinate enough people in the community. So for our county, the most current data we have is that we've administered more than 100,000 vaccines, and that's thanks to Jolene's efforts through the Department of Health and the pharmacies. Our 18 plus population is at 64%. If you look at New York State, however, the 18 plus population that's been vaccinated, gotten at least one dose, is 73.6%. And according to the CDC, the US for the 18 plus is 71%. I think it's important for people to realize, and this is current data, that for St. Lawrence Health System and for Claxton Hepburn Medical Center, when we surveyed the physicians, the vaccination rate is well above 90% at both organizations. If you look at the trend in vaccination, we went from like 7,000 per week at week 15 of the vaccination campaign to now we're somewhere in the between 400 and 600 vaccines per week. If you look at the regional comparison, if you look at St. Lawrence County, we're at the bottom of this, not necessarily because we're at the bottom of vaccination, but just alphabetical. But we still have, and this number needs to be updated, but probably at least 4,000 people who need to be vaccinated in order for us to hit that 70% mark. One of the questions that comes up is vaccine mandates, and I think this might have been discussed last week. So as people are probably aware, there are many governmental agencies across the US, lots of businesses, more than about 600 colleges and universities, as well as healthcare systems that have basically announced these vaccination requirements or mandates. New York City for their employees, New York State for certain employees, Walmart, for example, of businesses, and counties are starting these vaccine mandates. It is, as Jolene mentioned, a requirement for entry into Canada from the US. And all entities, with the exception of Canada, actually, they don't allow a religious or medical exemption as far as I can tell, but all of these other entities are required by US federal law to have a religious or medical exemption. Some organizations do include another opt-out. For people who decline vaccination, there are these enhanced mitigation options that are available, which essentially means people end up being tested for COVID like on a weekly basis. The advantage of having these mandates are you increase, vaccination, which protects the health and safety of your workforce. It also protects the people that your organization serves. And I think overall, from a public health perspective, it helps our businesses and schools stay open. There are, however, a number of questions that any organization would need to answer. One of the questions is, who pays for the cost of testing? There's a question for some people of whether mandates should wait for full authorization by the FDA. One of the other questions is, what are the criteria for opting out? And then some organizations have wrestled with the idea of only having some employees be mandated especially employees who maybe have a public-facing component of their work. Those are just questions that I'm sure people have thought about and may want to discuss. As far as masking, what we know about masking is that the vaccinations are very effective at decreasing severity of infection, but also reducing transmission. We know that around 50% of the total population of St. Lawrence County, not just 18 and above, has not been fully immunized. We know that unvaccinated individuals are at very high risk of COVID. We know that unvaccinated individuals increase the risk of breakthrough cases in vaccinated individuals. And we know that vaccinated individuals with breakthrough cases are contagious. And we know that properly worn masks do reduce the transmission of COVID-19 in indoor spaces. So based on this, the consensus in the medical community by the CDC, as Jolene talked about, is that in areas of substantial to high transmission, especially those areas with low vaccination rates, masks are recommended to be worn indoors, regardless of vaccination status. And as Jolene also covered, masks are recommended in pre-K through 12 schools indoors, regardless. This is part of a multi-layered approach with an emphasis on vaccination, but realizing that masks are important. And again, it's for the community to achieve this shared goal of keeping our schools open, keeping our businesses thriving, and really keeping the medical community safe as well. So booster shots. So there's a lot of information out there about booster shots and a lot of questions. I think it's important that people are clear about the terminology. So booster shots, technically speaking, are generally an additional injection of the original vaccine that the person received. So if you've got 2 Pfizer shots, it would be like a 3rd Pfizer shot or a 2nd Johnson & Johnson shot. An updated vaccination would be if Pfizer, Moderna, or J&J modify their vaccine formula to address the variants. So that would be an updated vaccine. And then finally, there's this discussion of mixing and matching. So some researchers in some countries are actually suggesting that if you had a Johnson & Johnson vaccine, you get a 2nd dose of one of these other vaccines. The thing to realize is that right now, none of these approaches is approved or recommended in the United States. So if you're reading about it and you think it's a good idea, just keep reading about it because it's not an option at this point. Israel, Germany, France, and the UK, and probably some other countries do have programs where they're providing boosters, especially to higher risk individuals. So some are using an age cutoff, some are using a comorbid illness. At this point, it's a point of research. The CDC is carefully looking at this. I'm carefully looking at it. When it becomes an option, people will be made aware. So finally, I wanted to just mention with the colleges. So, all 4 of our colleges are going to be welcoming students back for in-person learning. All 4 colleges had, very successful years last year, and they really didn't end up contributing to the cases in our community because of their efforts. Each campus has a safe plan for the return of the students. And this is something Jolene and I meet on a weekly basis with the leadership from each college campus. And so each college campus is really emphasizing vaccination. As people may be aware, Clarkson and SOU are mandating vaccinations. The SUNYs are going to mandate it once there's full authorization from the FDA. As far as lab testing and surveillance, each of the campuses is going to rely again on PCR testing, which is the most accurate testing. They have different protocols, which have been reviewed by Jolene and I, and will be probably modified based on what's happening with Delta. For mask policies, again, they're going to be based on the CDC guidance. I said New York State guidance. New York State, Albany is quiet on this, but it's probably going to be CDC and local public health that will be helping them with their mask policies. And then finally, they're going to continue to be actively engaged in contact tracing and quarantine. All of this is done in collaboration with us. And again, we had an excellent year last year, and I expect we're going to have a good year this year as well. So just to summarize, so nationally, regionally, and locally, there's a significant increase in cases, as well as hospitalizations, and it all seems to be driven by this Delta variant. Areas of low vaccination are most vulnerable. St. Lawrence County isn't technically at the bottom of vaccination, but we're on the lower end of things. Breakthrough cases are definitely real, but they're still the minority of cases. We know that vaccination prevents severe COVID, hospitalization, and death. We also know that St. Lawrence County, we initially sort of led the state in vaccination rate, but now we're below both the national, state, and regional averages. Vaccine mandates are being rolled out throughout the country, by these large businesses, governments, and by universities and healthcare systems. The schools, fortunately, all have plans to reopen for in-person learning, which I think everyone agrees, or most people agree, is a great thing. The colleges are starting and our businesses are reinvigorated, but we really have to have this sort of flexible, sensible, multi-layered approach, emphasizing vaccination, but also strategic use of masks to help us maintain the forward progress that we've made, and in particular to weather this storm that's coming because of the Delta variant. So that's my presentation. If people have questions.
Any questions? Mr. Arquette?
Thank you, Mr. Chairman. The number of vaccinations were in and around 104,000 is the number that I thought I received. In relationship to the percentage, for somebody like myself who's had the double vaccination, does that count as 2 vaccinations for that information?
So that number, that 104,000, that's actually just a total injections. So because most of the vaccinations were done with Pfizer or Moderna, which are a 2-shot series, that's how the math works out. So that's why we're at 50% of total, or 64% of 18 and above.
Thank you. Mr. Burke.
The availability and costs of testing, could you comment on that?
So in anticipation of unfortunately, the pandemic continuing, certainly for St. Lawrence Health System, for the community health centers of the North Country, and I believe for Claxton, we've continued to maintain the ability to provide testing throughout the community. The hours for some of the facilities had sort of been cut back, but as demand increases, we'll make sure that the hours are expanded and that people have the option for testing. We do have PCR testing available with a fairly rapid turnaround time, in the sort of 24-hour range through St. Lawrence Health System and through the Community Health Center. And I think Claxton has worked on that as well. So there's good access to testing. It may need to expand as more people want to be tested. And the other thing with the border opening, we're all noticing that, people who run the testing sites, that people are coming and saying, I need to be tested because I need to get across the border. So that's going to add a new element.
Test free.
Mr. Burke, go ahead.
The test free.
He's asking the questions, who absorbs the cost of the test?
So typically, and I don't want to speak for each organization, but the organizations tend to bill the patient's insurance. Some of the organizations have decided if the insurance doesn't cover the cost, then they won't bill the patient directly. But again, it's different for each organization. I don't want to speak for each of the organizations.
Sure.
Dr. Williams, is there a graph showing for St. Lawrence County in the age group 12 to 18, the level of vaccination? Do we have any data on that? I'm interested in individuals who need their parents' permission or parents' guidance to actually be vaccinated.
Jolene, do you have that graph easily accessible?
So I don't have a graph for just the 12 to, from the hub data. Yes. Give me 1 second and I do have that. Our hub changed from updating their data on a weekly basis to an every other week basis, but our regional dashboard. you see this right here. So for the 15 to 19, so our hub doesn't have the 12 to 18, so not quite the age range you're asking for. But with the 15 to 19-year-olds, we are about the 64%. I do believe it is a little bit lower with the 12 to 14-year-olds. But there's not a readily available graph for that.
Okay. So I think what's happening, at least parents that I talk to, their concerns about actually how the actual vaccine worked and the effect for fertility. We did talk at one of our public health meetings about heart inflammation. And CDC, after that meeting, within a week, did put out kind of a warning about heart inflammation, I think particularly in males. And I think that what parents are doing is they're looking at the risk of COVID as the fatalities versus actually the vaccination. So I don't know if more information needs to be released about how the vaccine works, whether it's the spike proteins, if it affects the DNA or the RNA. I think some of the people that I've been talking to have questions that I can't answer about how the vaccine actually works. And I think their concerns is the unknown and how that'll affect their young child's body in the future.
So I'll answer at least part of that, your question. So first of all, just to be clear, the vaccine does not affect the DNA. And there's some information that I presented, I think, kind of early on that I'm happy to re-present at some point or share with individuals. But so just to be clear, the vaccine does not affect the DNA. It does not alter people's genes. It's because they're RNA vaccines. They just provide a temporary message that help the cells create these spike proteins that stimulate the immune system to develop antibodies. The vaccine itself then basically goes out of your body after 2 to 3 days. As far as fertility, I presented at a previous meeting, all the actual research that's coming in is demonstrating that there is no impact on fertility. And all the major medical societies, including the people who are fertility specialists, so they have a business interest in fertility and that's their specialty, they've made statements to the effect that their review of the data supports the safety in terms of fertility. I also mentioned that there were 2 studies published looking specifically at like sperm counts, and they show that there was no negative impact from vaccination. As far as the heart inflammation, so that is something that was found to be described as an extremely rare effect from the vaccine that was noted a little bit more commonly in younger people. What I would say, and I'm not a pediatrician, I take care of adults, but working with my pediatrician colleagues and reviewing the data from a medical perspective, people should be far more scared of their children getting COVID and the effects that the COVID infection will have on their children than being scared of the vaccine. And at the end of the day, I'm a parent. I made this decision, a co-decision with my teens. And again, people should be far more scared of getting the COVID infection than they should be of the vaccine. I think the Delta variant also changes the equation, because in June and July, when we had 0 to 1 case per day, it's kind of easy to sit back and say, I'm worried and I'm just not going to do anything. I think with the Delta variant, and I'm not saying this, in an effort to, I'm not trying to hype up the variant. I think it's a very real thing. And I think the experience in all these other countries shows that it's very contagious. It seems to have a tendency to affect younger people, possibly because there's less vaccination there. But if people, even younger people, get the COVID infection, their risk of heart inflammation, for instance, is estimated to be like 300 times higher than the risk from the vaccine. So these are tough decisions that people need to make, but I think they should make them from a point of understanding the research, and we can certainly do more in the medical community to communicate that.
So do the spike proteins remain, and they become permanent?
They do not, and that's part of the process. Is the spike proteins are produced by our cells with a message from this vaccine, then the spike proteins are identified as being a foreign, invader by our immune system. Our immune system creates antibodies and basically destroys the spike proteins. So if you try to measure spike protein levels like weeks later, you're not going to find them, but what you will find is antibodies that are ready for when the actual virus with its real spike proteins comes along. And that's, sort of the science of vaccination in general.
So I have just one more question, if I may, and that is for someone that has COVID, you're still recommending that they get the vaccine. There has been some in the literature that people that have had the COVID have more advanced immunization. Would that be a true statement, or that has to be researched?
So what we've, what has been observed is that, people who've had the natural COVID infection, first of all, to be clear, they should not be vaccinated while they're still symptomatic. But once they've recovered from the natural infection, there is a recommendation that they go through the vaccination process. Some clinicians will have people wait for sort of a 90-day period, to fully recover. And there is a little bit of controversy about whether one vaccination of the 2 vaccination series, like Pfizer or Moderna, may be sufficient. But at least as of right now, the FDA and the CDC have not changed the recommendation to get both doses. There is, I will say, some discussion in the medical community about whether one dose would be sufficient, but that is currently not the recommendation.
Okay, thank you.
Mr. Forsythe.
Thanks, Doctor. I think it's for Jolene, this one. I think you said 78 active cases presently this week. Is that what I heard?
77 so far this week.
Out of that, what percentage were vaccinated?
I do not have that. I do know the ones that came in today were not vaccinated, and our 7 hospitalized people are not vaccinated.
I can speak to that a little bit. I can't give a percentage, but obviously this is something that we're all watching carefully. And I would say that the national trends that I reported, which unfortunately, as I indicated, do not include New York State, since New York State somehow doesn't report that. I'd say what we're seeing locally is pretty similar to what is being reported nationally. The majority of people who are positive are definitely unvaccinated, but there are people who are vaccinated who are getting it. So breakthrough cases are real. Getting back to hospitalizations, I'm in the hospital right now, and also the ERs, which we don't report, but most of the ER visits again are unvaccinated people.
Okay, so it follows the national trends. All right, that's all I need.
Mr. Reagan.
Doctor, do physicians in the county, who have their own practices, do they have the vaccine to administer to their patients so they can have a discussion with their patients and offer them the opportunity if the patient is interested?
So I'm glad you brought that up. I mean, as a practicing physician with office and health center, I really feel strongly that for people who are kind of on the fence about vaccination, that having the opportunity to speak to their provider in the provider's office, and then if they choose to be vaccinated, being vaccinated in that provider's office, I think that's a great idea, and it would be a great plan. And about 2 months ago, we shifted our focus to try and make that happen. St. Lawrence Health System, for instance, does have that option at 2 of the campuses where there are a lot of physicians. The problem that we've run into is because these vaccines, the Pfizer vaccine, once you open a vial of the vaccine, it has 5 to 6 doses in there. Once you open it, because it doesn't have preservatives, it only lasts for that like half day. So because we're only seeing 1 or 2 people per day who haven't been vaccinated, who want to be vaccinated, we're really having a hard time using all the vaccine once we open it and avoiding this issue of wasting vaccines. And that's been the experience in every context where we've tried to use it in providers' offices.
But what about with the Johnson vaccine?
Jolene, you might be able to speak to those issues there.
So Johnson & Johnson is a similar issue. There's 5 doses in a vial. Once the vial is open, you still only have 6 hours to do it. But New York State has not received a new shipment of Johnson & Johnson in the last 2 months. So we in our office, we have 10 doses of that left. 5 of them are going out to homebound tomorrow. And I think we'll use the other 5 for homebound next week. But the state's not getting any more Johnson & Johnson in right now from the federal government. And they're not redistributing to the North Country.
Thank you.
Ms. Hager.
Thank you, Mr. Chairman. I'm not sure whether Dr. Williams or Jolene might have this information, but for organizations that are considering a request for people either be vaccinated or tested, and if that organization might be self-insured, some of the tests are upwards of $85. Is there a way or that we, that you know of, that a group could negotiate for testing that wouldn't be as pricey as that?
So I think there are opportunities, and I'm happy to talk offline. Again, I think because this testing issue isn't going to go away, and because it may actually even become more necessary, there are, some institutions like SUNY Upstate, for instance, where they can do very high volume testing at a fairly low price. Some of the organizations locally may also be able to fill that void. So I think especially for an organization where there's a need for a higher volume of testing, those kinds of things can be discussed or worked out.
Thank you.
Sure.
Jolene, earlier tonight you talked about the transmission rate, and you mentioned, I think, if I'm correct, it's 46 per 100 cases, St. Lawrence County at this time?
That's correct. And that's the 7-day, a 7-day time period that does not, from August 1st through the 8th, or through the 7th.
I think it was either you or Dr. Williams described this as a moderate increase. That number represents a moderate increase?
Not a moderate increase. We're in a moderate transmission level. So there's low, moderate, substantial, and high. And with our case count from today, once today's numbers get included into that CDC count, we'll be in a substantial transmission rate.
So what would it have to increase from 46 to what in order for it not to be considered moderate?
So once it's 50 cases per 100,000, it changes to substantial. So it's 20 to 49 is moderate, and 0 to 19 is low.
Thank you.
Anybody that hasn't spoken, Mr. Urquhart.
I'm good, Mr. Chairman, and then Mr. Sheridan has to ask me.
All set? Mr. Aker.
So currently, there's 40 beds still available at St. Lawrence Health Systems, Dr. Williams?
Approximately. What I would say is that St. Lawrence Health System has not. We continue to have a flexible, dynamic plan to expand as much as possible for more patients.
So currently, with 7 patients, then we're pretty safe. I mean, we're only at say less than 20% of capacity then, as far as hospitalizations.
I would say right now our capacity is good.
Thank you.
Anyone else? Doctor, I have a question. As you recall, during after the onset of this in March of last year, up until just a few short months ago, anything having to do with COVID in the form of protocols or suggestions came from Albany through the different county setups that were enacted by the government. That's changed now. There are no more executive orders coming out of Albany with any direction, and that's particularly a note with the school system. If there are questions, who's going to answer them now? Is it public health? Are we waiting for the CDC? Are we looking to the Department of Health in Albany? Who should we be going to? Who should we be listening to?
So, yeah, it's an excellent question, and I think those of us who do this professionally, I think it was there were lots of challenges when we were getting edicts from Albany, but there is something sometimes beneficial of having like some sort of central structure. I think at this point, many of these questions are, frankly, people are deferring to the CDC on a national level. But I think some of these decisions are going to be made on a local level, and it would be a combination of the Board of Health, the Department of Health, and the local medical community. I think even for some of the questions.
Thank you. Any other questions?
This may be.
I'm sorry, go ahead.
Sorry.
If you had something else to say, go ahead.
I'm just saying it'll be interesting to see if Albany remains as quiet about this as they have been in the past weeks. I think there's some changes that are happening in the Department of Health and so on and so forth. So they may not remain quiet in the next weeks or months to come.
Well, I think what the concern may be is that there's going to be a gap because of everything that's going on in Albany. And I think that people need to know that somebody's in charge, who it is, who's making the decisions, and that those decisions are being based on good science and good medical practice, and not from some unknown individual in either Washington or in Albany. That's my thought.
Yeah. So I think between the Board of Health on the county level and the Department of Health, we're certainly very eager and willing to lead locally. And we do also work, from a Board of Health perspective and from a medical community perspective. There's a regional group of physicians who continue to meet to discuss these policy issues. And so there is leadership, and I think it's a sensible group of people that everyone will be able to turn to.
In the county, at the public health county level, we have the same thing with the local county health departments, but also with all of the health departments in the state. We do meet on a regular basis to go over the different recommendations and to put into effect more of strategies that are going to be similar across all of the counties.
And I think that everybody here is well aware that public health and Department of Health is there to take care of business. But I wanted to hear that from you so that the public that is tuned into this knows that it's in good hands, it will be taken care of, and there is a protocol in place for all just about everything. So unless there are any further questions, and I see none, thank you very much, and we appreciate your time and the information you gave to us.
Thank you.
Thank you.
Okay, moving right along to the presentation of resolutions. The first resolution under public health is authorizing the chair to sign a contract with Health Research Incorporated for the New York State Public Health Corps Fellowship Program. Moved by Ms. Kern, seconded by Mr. Sheridan. Elaine?
So this resolution is for a new program that the governor has created. It will be, the program statewide will create 1,000-ish new fellows, no more than 1,000. It could be a little bit less depending on how it rolls out. We have been awarded up to 10 fellows on an annual basis for 2 years. Along with a local coordinator to help build public health capacity to support the COVID-19 response, but also some of the other areas of public health, including community outreach. The the contract is for a total of $766,333 on an annual basis for 2 years.
Any questions? Comments? Seeing none, all in favor? Aye. Opposed? Carried. The next resolution is authorizing the chair to sign a subcontract with Health Research Incorporated for the New York State Public Health Corps Fellowship Program. Moved by Mr. Burke, seconded by Ms. Curran. Jolene?
So this would allow us the option to subcontract with HRI to do the hiring for us. We are still in talks with the state about the how to do hiring along with a lot of other counties, but they are looking to have the program start at the beginning of September. They are accepting applications currently through their online portal. So this just would give us another option to do hiring.
Any questions or comments? Mr. Ray?
At the end of the fellowship, what qualifications will people have to be chosen for the fellowships first?
At the end of the fellowship, once they've completed it, or to be a fellow?
To be a fellow, what kind of qualifications are they gonna have?
So there's different levels of fellows. There's a fellow, just a regular fellow, which can be anywhere from a high school diploma to a bachelor's degree. They are preferred to have an associate's or a bachelor's, but depending on the experience that an individual has, because they are looking to hire retired people, medical people, really anybody that wants to help out with public health workforce. That would be a regular fellow. Including clinical RNs would fall under a fellow. Anybody with a master's degree or within 1 semester of completing their master's would be what's called a graduate fellow, and we have been awarded up to 1 of those. And then a senior fellow has to be a doctorate level or within 1 doctorate, and there will be, I think, 10 or 20 of those in the state. Is keeping all of the senior fellows for the state.
Thank you.
Any further discussion? Seeing none, all in favor? Aye. Opposed? Carried. The next is authorizing the chair to sign a contract with the New York State Department of Health for the lead poisoning prevention program grant. Moved by Mr. Smithers, seconded by Ms. Kerr. Elaine?
So last month we did the extension. So this is for the time period of October 1st, 2021 through September 30th, 2026 for the amount of $35,829 for each year of the contract. And this helps support our work that we do with the lead poisoning prevention program. So case monitoring, education, contacting doctors' offices, all of that goes with this grant.
Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. The next is authorizing the chair to sign a contract with Twin Tier Pathology for morgue and laboratory services. Moved by Mr. Perkins, seconded by Ms. Curran. Jolene?
So this is a renewal for Twin Tier Pathology. We started working with them last year. And just to give you guys a little bit of numbers for where we are for autopsies. So in 2019, we did 61 total autopsies. 52 were done in county and 9 were sent out. In 2020, we did 62 total autopsies. 55 were done in county and 7 were sent out. so far this year, and we're just in August, we've done 60 autopsies to date. 57 have been in county and 3 have been sent out. So we are looking to renew our contract with Twin Tier Pathology to continue on with autopsy services.
Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. The next is authorizing the chair to sign a contract with Monroe County for morgue and laboratory services. Moved by Mr. Smithers, seconded by Mr. Sheridan. Go ahead, Jolene.
This is another renewal from Monroe County to provide the same services. We'd like to have an option, a couple of different options, just in case one of them is unavailable to take our autopsies when needed. So we would like to renew our contract with Monroe County.
Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Next is authorizing the chair to sign a contract with Health Research Incorporated, New York State Department of Health, for epidemiology and laboratory capacity, COVID-19 enhanced detection, and modifying the 2021 budget for the Public Health Department. Moved by Ms. Curran, seconded by Ms. Fiacco. Elaine?
So this is doing a budget modification to move the funding that we have accepted last month to the appropriate lines. And just to know the overtime line, I was asked to split that out or give some numbers where we are. So in 2020, we had approximately $155,000 in overtime costs. So far for 2021, we have right around $87,000 for overtime.
Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Next is authorizing the chair to sign an agreement with Health Research Incorporated, New York State Department of Health, for epidemiology and laboratory capacity, reopening schools funding, and modifying the 2021 budget for the Public Health Department. Moved by Mr. Denisha, seconded by Ms. Kern. Go ahead, Jimmy.
So this is our grant for the school screening testing program. We are still expecting the Department of Health to put out recommendations for school testing. They are going to be doing that shortly, they have said. So we are looking to move money from just our one line to cover the cost of where the service would be, including getting the actual supplies for testing.
Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. The last resolution authorizing the chair to sign contracts with contractors, subcontractors, and consultants for opioid epidemic grant funding and modifying the 2021 budget for the Public Health Department. Moved by Mr. Smithers, seconded by Ms. Kerr. Go ahead.
So this is for our opioid epidemic grant funding for the next year from September 1st, 2021 through August 31st, 2022. And it moves the lines from the line that we accepted it into the appropriate line for our staff that support it, along with workshops and speakers and advertising and the other fees that go along with the grant.
Any discussion? Seeing none, all in favor? Aye. Opposed? Carried. Jolene, is there anything else?
I think that's it for me tonight, unless you have any other questions.
Any other questions for Jolene? No, you're free to go. Thank you.
Thank you.
The next resolution deals with social services, and Ms. Ackerman is not going to hear it tonight?
No, I'll present.
Okay, you'll take care of it?
Yep.
Okay, so the next resolution is modifying the 2021 budget for the Emergency Rental Assistance Program and the Safe Harbor Grant for the Department of Social Services. Moved by Mr. Burke, seconded by Ms. Burke.
So this resolution, you may recall last month allowed for a contract with Messina Independent Living Choices that would assist folks with getting their applications complete and submitted. As of August 1st, there have been 304 submissions, applications complete for rent arrears. There have been 249 applications for prospective rental amounts due, and there are 69 applications submitted for utilities in arrears. So there is, I think, a little bit of momentum building for the work Messina's been able to do. A while ago, I shared with all legislators the totals amongst zip codes. I think that's something that we'll try and provide to you when we get it by zip code. The state had a couple of hiccups because they're monitoring it cumulatively, but I'll try and keep you informed as far as zip codes certainly that fall within your districts. This resolution does two things. It appropriates funds, the $120,000 for Milk to do the work that they're doing. It provides an opportunity for the Safe Harbor Grant to transfer some of the appropriations, and it recognizes the reduction in revenue for this year. So you can see in the budget modification, the training and travel was where those increases were made, and the recognition in that decrease of the revenue is accounted for. Questions?
Seeing none, all in favor? Aye. Opposed? Sherry, are you going to?
Can I speak to it briefly?
Statistics.
Yeah. So on your desks is the second iteration of the social services update. I would request that while you have it in front of you, you take it with you tonight and go over it. And my hope would be that at finance, Cindy will be with us. I can go over the pieces that have changed. I think we mentioned briefly to you that this will take some time to get where we'd like it to be, that we also intend for this to be a living document that represents the children that it accounts for. And so we'll continue to provide and take suggestions on it. So I draw your attention to a couple of the changes that we made. There was a request on the second two charts listed on the first page to add the numbers attached to the percentages. So you'll see that in a couple of places throughout the document so that you can get a better idea. I think from an average standpoint, giving you those as well is an important piece of information. We did change the language referred to at the top to referrals. I think we had cases last time we shared that with you. So again, we're continuously trying to tweak those data points so that they make more sense to you. You've got your averages and then your increase. I would note the fact briefly that the calls or the children added were 100 less than last month. So that, I think that's something we all know. We don't control what's coming in, but they respond to it. So that's of note. Again, very proud of the staff and the safety checks at the bottom of that page as well. Same reporting, we gave you that median last time. Information presented the same way on the next two pages. We're looking at how we might get a hold of, someone had asked about the New York State median on caseload. We do, and you've seen before, the list of each county in the 3 different areas. We're looking to see if there's a median that we can provide. So spent quite a bit of time between the report provided last month in the data here and the county attorney's report shared with you, trying to get those to match where they can and where is appropriate. So the total caseloads are matched up there. And then you see all of the net changes to each individual employee. So continuing again to work, I think one of the questions that was raised last month was about any decrease in cases, whether it were closed or whether it were transferred, needs to be delineated between, because we saw some pretty swift changes nearing 20, I think, that we want to clarify those weren't closed. Those actually went from someone going into a new position to a different caseworker. So continuing to work through what that looks like. You see your trainee period now has a little more data. So those are new employees there on page 3. A little more data on who's going to finish in September with their training and then move in. We've got a few folks who'll finish in October. You then see at the bottom, similar to last month again, the case is closed and the years of service. Moving over to prevent services, again, this was a number I think that was in dispute a bit between the 2 reports the board saw in the last month. Children in care has been matched up between the county attorney and the commissioner. So that 317 is the total number in care at this time. That does include the juvenile delinquent cases, and we're looking into that a little further to make sure that it should be included in that number or a separate reporting mechanism for that. Better news on the net change to children in care. If you look there were 11 removed from care and only 1 added to care. So that certainly is a bit of a change from what we've seen. We are in the bottom of page 4, looking to get some additional clarification. As you're seeing some children move out of care, the date and the numbers continue to work against that total. So we're just looking to get some clarification and continue, again, improving the information you're receiving through this report. You then move on to what you saw last month as well, with the children in home receiving services, and then similar to CPS, the cases by employee. On the page 6, flipping over there, again, trainee period that you saw with CPS. You've got their training period should end between September and October. Again, we'll keep you informed as folks move through that pool that you created, and the hope is to keep that pool full of caseworkers. Cases closed and prevent, that's a different process certainly that you know of from CPS. And then the adoption activity is the area that looks probably the most different to you this month. And what I mean by that is we changed the way we're reporting. This report was given to you in a line graph that I think was a little bit confusing. So we've changed that out to give you the total in the bar and break it down by freed for adoption, those without a resource, and those adopted. So that one in July, we expect there's a little bit of crossover with reporting between the 2 offices. We're working again through that and hope that next month all of our numbers on the adoption activity match up. So I hope that one's a little easier to reflect on compared to last month. And then you've got the placements on each for the month and then the average. And those also have the numbers added. I think last month percentages were there for you as well. And then the last page for the eligibility programs, that's the same as you've seen it reported. And I don't think there were any specific questions on eligibility programs that was needed at the time. I'll try and answer any questions, certainly about the format here, but if we could have the discussion at finance with any questions you may have going forward, I think that would be helpful.
Mr. Burke. Two questions.
Sure.
The acronym are, that they are the first page.
Oh, yes. Family assistance. Let me get that for you.
Family assessment response.
Family assessment response. There you go. My apologies. Thanks, Suzanne.
On page 6, bottom of page.
The adoption?
Yeah. What's the difference between children free without adoption resource and children free for adoption?
If it would be okay with the chair, I'll have Steve speak to that.
Certainly.
So I think everybody's familiar with, at least from a 50,000 foot view, the process for a neglect and abuse case. Petition is filed, court can decide whether or not to remove a child and place it in a foster care setting. During the course of moving forward, if the child remains outside of the care of their parents for 15 or 22 months, then the department actually can be directed by the court to file a termination petition, essentially terminating the rights of that parent, that child, to free the child for adoption. That's the technical term that is put in there. So when you see freed, that means the child has actually gone through the termination process. The court has determined that it is appropriate to move the child to a secondary home for permanency, and they will, in fact, move to the adoption setup. Now, not every child that is freed ultimately ends up with a resource to be placed with for permanency. So what you see there in the blue are children that have, in fact, been freed who have an adoptive resource. The green represents the children who have been freed but do not have an adoptive resource. And that's not uncommon. What you typically find is that children between the ages of 14 and 18 who are in the system, who have a say now under the law as to whether or not they move forward with an adoption, may have been freed by order of the court, but may not wish to move forward with an adoptive resource. So it is not uncommon to find children in that age range that do not wish to be placed in any other household from it. They'll wait until they get 18 or 19, and then they will most likely try to move on their own.
Good for now?
Well,
And the only other area I would point out on the foster care placements, I believe that Cindy shared with the group, the number for Kinship, the goal, at least at this point, was the 50%. Last month, we were at 54%. This month, we remain above at 51%. So I think that's a metric that is a very important piece of Family First, which will become, I think, more important as a guide moving into September, October timeframe. So I'll have her give an update on that, as well as take any questions that you have next time. Jim has his hand up.
Any other questions?
Jim?
Mr. Reagan, what is the definition of kinship?
So it's my understanding there's two forms of kinship. The first is formal placement with an approved kinship, which is a family member of a child going into care. There are also situations where children may be placed with a family member, a kinship type setup, but they may not be officially approved through that process. So I think there's both of those going on. And a big goal of Family First, as I understand, is a lot more of those set up, almost all of our foster care moving into some type of kinship environment.
Now, children who are currently with foster parents, are we taking children from them to put them into with relatives who may or may not be distant relatives or whatever?
I can't speak to if that process occurs, but I can find out. What I do know is that caseworkers are assigned the task of locating kinship navigators, they're called, and their task is to identify those and establish those as appropriate placement. But I can find out the answer to your first question.
The reason is, in some cases you have children who've been with a particular family for an extensive period of time and have, the families have formed attachments to the children and the children as well. And, I realize, that the goal of Family First is to put them with a family member of some sort, but, I'm just wondering whether it's healthy to move them after they've been with somebody for, a year and a half or whatever, lengthy periods of time and, have, form these bonds and then find themselves in uncertain territory.
Happy to find that out for you.
Thank you.
any other questions? Ms. Hager?
Thank you, Mr. Chairman. I've asked this before, and I'm sorry, I don't remember.
That's okay.
When Family First happens, there's a percent of kinship placement. Is it 90?
I believe it starts out at 50, but I believe that by the end of Family First, I believe the act finishes in 25. I'll confirm that. I believe the goal ends up around 90 to 95.
Okay,
Yep.
thank you. And we're like 50s.
We're in the 50s. So with the established criteria they have for September 30th or October 1st, I believe we meet that criteria at this time.
Thank you.
Anyone else?
Okay.
I have a question for the county attorney, if you don't mind.
Sure.
I think that you said that there are 4 JDs that are in our care and custody.
That's correct.
Okay, so here's my question. We've got, roughly 300 children in our care and custody. Most of those are under Article 10, I would assume.
That's correct.
Okay. So the Article 10 has to do with safety and security, usually in a home setting or in some other way that they're affected.
Under Family Court Act, Article 10, those are actions that are brought in which the allegations are that the caregiver engaged in either neglect or abuse of the subject child or children.
So for a JD, a juvenile delinquent, what protocol is there for determining that they are under the care and custody of the Department of Social Services, when it has nothing to do with an Article 10 proceeding?
I think you already know this, but one of the weird undertakings of the county attorney is that we are in fact the chief juvenile delinquency prosecutors in the county, and this was the case even before I was involved with DSS. The process is very much like what we envision associated with the district attorney and prosecuting. There is a petition brought that charges or alleges that a child has engaged in an act that, if committed by an adult, would constitute a crime. Obviously, the severity can range based on the nature of the act that is alleged. If, at the conclusion of the fact finding, the judge determines that the child has engaged in that act, you will move on to something called disposition. This is very similar to a sentencing structure in an adult criminal matter. In the dispositional phase, the judge has many different avenues that they can go to. They can go ahead and place the individual on probation. They could go ahead and indicate that they need to go into a non-secure location where they remove the child from their regular home under the care of their parents and place them in a foster care setting, but that it wouldn't be secure. They could come and go. They would have visitors. It would be much like a boarding school. And then there are the secure locations. When the child is removed from the placement of the parents, at that point, there are two options for the court. The court can either place the child in the care and custody of the Department of Social Services through the commissioner, or they can place the child in the care and custody of the commissioner of OCFS, or the Office of Children and Family Services for the state. We have 4 such cases of the 317 as of July 30th that are JD cases. These numbers are effective only through essentially July 30th. There's actually been a fair amount of activity that's taken place since then. Those 4 JDs, unlike your Article 10s, will not move towards a foster care arrangement in the end. They won't move towards an adoption in the end. And it's something that is regularly evaluated to determine whether or not continued placement with the Department of Social Services or an elevated placement with OCFS is appropriate. In fact, if I recall correctly, when we reviewed these numbers on August 4th, what we determined were that 2 of the JDs were in fact voluntary. What that had meant was that they had originally come in under a juvenile delinquency, they had been placed in the care of the commissioner, and then they had hit an age where they had elected to continue to remain in the care of the commissioner. Sometimes that happens if they don't have a household to return to. Sometimes that happens if they are part of a schooling function. They've gone on to college as an 18-year-old, and there is a means to provide care and support through the Department of Social Services. And as I indicated, 2 of these 4, if I recall correctly, had in fact reached the age of majority and yet had continued to engage in voluntary services. So while they were placed with the commissioner, they were over the age of 18, and they had started before the age of 18 with the commissioner.
But we are carrying those numbers along with the Article 10 placements that we have. Is that really where they belong?
Well, from a dollar standpoint, they're still a child in care. They are still a child that will receive services through the Department of Social Services. But not in the same way. Oftentimes with your JD, the services are dedicated to its child, and that's it. With your Article 10, everybody in the chain gets the services. Mom, dad, the child's siblings. And there may be a varying array of services provided to each of those individuals in the mix. So they are, in my mind, apples and oranges. Even though there are some similarities that they are in fact placed in the care of the commissioner in those circumstances, there are some significant differences, both from a financial standpoint and from an operational standpoint.
Thank you very much. Any other questions? Okay, anything else, Ruth?
Not at this time.
Okay, so we'll move on to community services. Leora, are you there?
I am.
Okay, good enough. Thank you, Jay.
Good evening.
Good evening. The first resolution is one authorizing the chair to sign a contract with 1011 for revenue cycle management and modifying the 2021 budget for community services. Moved by Ms. Kerman, seconded by Mr. Smithers. Go ahead, Jay.
So this is actually has two prongs. One is for 6 months of what they call revenue cycle management, but we're used to calling it, doing the billing for us. And during that 6-month period, we've made it, fairly clear that we want this to be kind of a tutorial period where we learned to be able to do the billing ourselves and then be a warm handoff after the 6-month period. We would hope to be able to take over the billing completely and not have to outsource that. The other component to this is $5,015. And that is just for the initial setup. That's putting in like all the payers that we have, all the billing codes and things like that into the system. So that has a cost. The $21,000 for the 6 months of the revenue cycle management, if approved, we would be using leftover DSRIP money, which, as you recall, we were involved in the DSRIP project to start a primary care clinic. And that was like at least a 4-year project. And when you reached certain benchmarks towards the completion of that project, you would get the DSRIP money released to you. So money we accumulated over that 4 or 5 year period is now, since DSRIP is over, is unrestricted funds. So in that deferred revenue account, we have $351,000, and $21,000 of that we would like to apply for this revenue cycle management with the new electronic health record.
Any discussion? Seeing none, all in favor? Aye. Opposed? Carried. Moving on, the next is authorizing the chair to sign 2 contracts with New York State accepting the 2021-2022 New York State Governor's Traffic Safety Program and Child Passenger Safety Grants for community services. Moved by Ms. Curran, seconded by Ms. Haggard. Go ahead, Jay.
So this is an annual grant that we receive from the governor's office for traffic safety. $79,474 is specific to the traffic safety grant. And then an additional $10,035 will be towards the child passengers and safety training. We do the fitting stations for the public at their request. So the total amount is $89,509. It's approximately an increase of $300 from last year.
Any discussion? Seeing none, all in favor? Aye. Opposed? Carried. You have an update for us, Jay?
I do. So yeah, this is for July. So as you can see, our no-show rates took a little bit of a spike. I know on the addictions treatment side, there was a lot of no-shows for the first-time appointments for the evaluations. I really don't know the reason for that, other than I don't think people are doing particularly well. I had the numbers for the overdoses of this year. I left them on my desk, and I do not have those in front of me. But overdoses, are certainly, not good. I guess I'll put it that way in terms of the numbers. So people aren't doing well overall. And I think that a lot of people are using, so they tend to try to avoid first-time appointments if they know that, they have sanctions from the court and that they're going to have a positive toxicology test. So hopefully that this will not be the trend, that this is just a spike, but we'll have to see. In terms of clinic counselor visit averages, it's down just slightly. Again, I'm sure the no-show rate probably affected a lot of these parameters that we're looking at, a lot of these metrics. If you go down to the bottom left-hand corner, you'll notice that addiction services weighted face-to-face is up significantly from the historical rates. And the reason for that is that in June, there was guidance that came out that we could bill differently for services and that they reduced the time requirements that we needed in order to provide certain services. So like an initial assessment was typically 45 minutes to an hour. So they lowered that amount of time. So that's the spike, because usually we're in the 60% face-to-face. This month we're 74.3 face-to-face.
Jay, can I interrupt? Can I interrupt you for a second? Mr. Reagan has a question.
I'm sorry.
I said Mr. Reagan has a question.
Oh, okay, sure.
Mr. Thank you. Jay, could we, on the monthly report, could we get the number of overdoses and the number of fatalities from the overdoses so that we can have a running track of what's happening on the ground? You know, over the past several years, the county and the various agencies connected to community services have been throwing a lot of new services at people with addictions to help them and to help get them into treatment and help get them, to come to the clinics and participate in recovery. I'm curious to see what the practical results are, especially as we head into the new, once the methadone clinic opens at whatever point it opens at, and the new program that's going to be opening in Ogdensburg. I think it's important for us to see whether all these new services that we've been adding and that a lot of the agencies overseen by community services, they've been adding a lot of programs as well, and I think we need to see whether it's working. So basically, I'm asking for a on this monthly report, the number of overdoses and the number of fatalities related to those overdoses.
Right.
Is that a possibility, Jay?
Yeah. I mean, it certainly is a possibility. I just have to check in terms of, how we would want to present that, but certainly we can do that.
Okay, thank you very much.
Yep.
Please continue with your report. Sorry.
Well, I was talking about a little bit of a spike in the weighted services for the addictions, and that was because of the guidance the guidance came out in June, but it was retroactive from last year. But I guess it's fortunate, but also unfortunate, because we have such timely billing now that it would have been probably a pretty mammoth job to try to go back and rebill everything differently. So, and then this guidance is ending for moving forward. So we only got a little bit of an advantage of it. So this spike in the addictions treatment side may not be the same next month because of us not being able to drop the time requirements for the guidance of OASIS. So the mental health weighted face-to-face, we do have a fourth clinician here. That would be the individual. It's at 47.6%. Again, they are, still sort of onboarding, so to speak, building their caseload. So hopefully those numbers will increase. and be on par with the other 3 counselors. In terms of the prescriber visits per 7 hours, you know, the 0.0 or the 0.80, that would be the prescriber that is now living in Arizona, who is simply bridging prescriptions and or doing some face-to-face, so to speak, over Zoom for those who are more at risk and are not stable. So we are anticipating onboarding a new nurse practitioner here very shortly. She did pass, you know, her exams and her boards, so we're soon to have her go through orientation and start prescribing to replace the previous nurse practitioner who relocated. In terms of the mental health waiting list, we have 46. Again, because of the new hire and then an additional new hire that started last week, we're hoping to get that waiting list down as well. In terms of May, you know, the numbers dropped with the number of individuals served. I don't fully have an explanation for that. The only thing I can think of is that the mental health clinicians, some of them terminated their employment, in some of them in part because of the mandate to return back to work. So in terms of, you know, what we billed and what we paid, we're still hovering close to 90% of reimbursement rate from payers. So I don't know if we have any questions, but.
Mr. Burke had a question.
Jay, are you still using telehealth, telemedicine?
Yeah, that's still, you know, the kind of the preferred methodology during COVID. You know, and we give them choice, but most people prefer to do it via telehealth. You know, we have a slight increase in walk-in traffic, but not a lot. It's predominantly telehealth.
Right. Yeah. James, when we're talking about substance abuse, what are the predominant themes you're seeing in our community? I know you said that the incidence of overdose is up.
Yeah. Well, I mean, I think the 2 widely abused street drugs are methamphetamines and heroin, and in those, both of those drugs have the potential to be cut, or not cut, but enhanced, I guess, with fentanyl. So, you know, those street drugs tend to vary from batch to batch, I guess, and, you know, certainly can be fatal if there's too much fentanyl, you know, in either of those substances. So I don't know, does that answer your question, Mr. Burke?
But it did, Jay. I'm just curious if we should be doing anything else. You know, I'd say that I think you're doing a very good job and your staff are, but as we look at gaps in the services in the community, I'm wondering if there's anything else that needs to be addressed.
Well, I mean, certainly not having an OTP up and running, you know, that's a gap that we currently have. Hopefully that will be remedied at some point. But, you know, that's a fairly large gap, I guess. And then also individuals coming out of correctional facilities who have gone through withdrawal because of not having MAP in the correctional facility. So they go through withdrawals. When they come out, you know, they think they can go right back to using the same quantity or the same amount that they used to. And a lot of times that causes fatalities because the tolerance is much lower, having gone through withdrawals and not been using for, you know, the amount of time that they were incarcerated.
Mr. Akers?
So Jay, I'm glad you brought up the OTB clinic. I had that in my notes for doing old business. We asked that at our last meeting is, what's the status? Are you working with St. Lawrence Health Systems? Are you in communications with, I believe her name is Jamie Smith? As to
I have both myself and Rebecca Maurer, who is the, I guess the project or grant coordinator, do have contact with her, yes.
So where are we at? I mean, we're 9 months into this now. What's the progress? I'm sad to hear that the VA clinic is moving out of that building, because I thought that could have been part of the OTB, or we could provide those services there. So is there any construction going on? What's the status?
No, there is not. So St. Lawrence Health Systems, or CPH, they submitted their application July 7th to OASIS. So approval of that application is still pending. It's my understanding that they had a walkthrough at the Center Mall. When I say they, I'm talking about the executives of St. Lawrence Health Systems and the mall personnel had a walkthrough tonight to look at, I guess, again, both the proposed place that they were going to renovate, and then also the VA clinic. So the VA clinic will be available November 1st, but that will not, meet the, the codes or the requirements for an OTP. Obviously, there's still going to have to be renovations if that's the route that they choose to take. So they are a little bit, in my mind, undecided whether or not they're going to try to kind of retrofit the VA space or totally renovate new space. But now that, they're saying that, the construction will probably start in the third quarter of this year, possibly the fourth quarter of this year, and they do not anticipate having the OTP open until the second quarter of year 2022. So that's approximately 18 to 20 months into the grant.
Totally unacceptable.
Anyone else? Mr. Forsythe.
Hey, Jay, on these stats, Jay, like the no-show rate is up. How about the other providers? Are you in contact with the other providers that do these? Are they experiencing the same upticks, or?
Are they seeing an uptick?
Yeah.
I have not asked that. I had not asked that, no, but I know a lot of the other providers, they hover around 20 to 25% no-show rates. So, we're still doing better than some, but I don't know if they've had an uptick in their rates lately.
As well as the wait list, the waiting list is starting to escalate a little bit or move up, and I just wondered if they're experiencing the same. So. All right.
Well, I know of one clinic that has 80 people on their wait list.
Correct.
So yes, I mean, there are other wait lists that are comparable or even greater than what we have. Yes.
Okay.
Any other questions? Ms. Germinelli.
Just quickly back to the OTP clinic. So when St. Lawrence Health Systems presented to us, they said that they'd have the clinic up and running in 6 to 12 months. What should happen if they don't have this clinic up and running by the end of the grant cycle?
Well, I don't think we've actually proposed that to the grants manager yet in terms of, this information that I'm sharing today in terms of it being second quarter of 2022 was just learned today. So we've got to check with the grant manager and see what she says about that. I'm not sure how that's going to fly yet. I will say that it was initially going to be a pilot program where they were going to choose certain clinic sites. When I say clinic sites, a clinic that we run, which is an Article 32 clinic. We have one in Governor, we have a satellite in Governor, satellite in Messina, and then the main PRUs obviously is in Augsburg and Canton. So they were proposing to do a pilot program to allow Article 32 clinics to integrate and also perform OTP services, meaning methadone dosing. And we were talking with our field representative about that, and at that time, she thought we would have a very good chance, us being county clinics, of being a part of that pilot program, because not only do we have the Article 32, but we also will soon have a mobile vehicle, which they've eased the restrictions on that and are now allowing mobile vehicles to do methadone dosing in the community. And then also because we operate forensic programs, both on the mental health and on the addiction side. So she thought we would have a good chance of being part of the pilot program. Now they've changed it and they've opened it up statewide. So they're not doing pilots. They're allowing anybody that wants to do this integration to apply. So, certainly that would be something that we would like to consider, given the fact that, it doesn't look like we're going to have an OTP anytime soon, at least not this year. So.
Okay. Anybody else? Mr. Akers.
Jay, this was a very contentious vote when we went through this. And one of the reasons I think that we selected St. Lawrence Health Systems was because, first of all, it was a private sector that the government didn't need to be involved in the business. That wasn't the primary one. I think the primary drive, I'll speak for myself, was that St. Lawrence Systems had what I thought was the whole gamut of services that would be available to any individual that came primarily for addiction. That they had mental health, they had physical rehab, had therapy, and everything else. And I can't tell you how disappointed, because it was a split vote. I believe it was an 8-7 decision on whether to go with St. Lawrence Health Systems or the county. I'm so disappointed.
Anyone else? Mr. Burke?
Just maybe a rhetorical question. Would we consider endorsing the mobile methadone? It's St. Lawrence County is a huge county. There's southern parts of the county. I know we talked about Credo having services down in the Watertown area, but when you get into some of Larry's territory, having a mobile vehicle that could deliver methadone might help meet more needs than what we originally thought. It's, again, rhetorical question. I don't expect an answer. But.
Well, and that's got a lot of hair on it. Yeah. We probably almost have to form a committee to look at that. But it's certainly worth looking at. And Mr. Sheridan, go ahead.
And Mr. Chairman, I was going to suggest that we have a meeting with St. Lawrence Health and express our concerns over the delay and tell them exactly how we feel, and then ask for some reasons as to why things aren't progressing a little faster. Is that something that we should do? Should we draft a letter inquiring and tell them that we need some action on this, and that there's a lot of people not happy over the idea that this isn't happening like we thought it was going to happen?
Mr. Denisha.
I think a meeting with St. Lawrence Health Systems would be appropriate, not to express our concern, but to express our displeasure. That we're strong in our concerns. Because they promised us things. That was what I based my decision on. I don't think they followed through.
Jay, what would your feeling be on that?
Well, I'm having a little difficulty hearing in terms of how we should move forward with St. Lawrence Health Systems or with the county integrating the OTP.
The thought was brought up by two different members of the board that they would like to see a meeting with St. Lawrence Health Systems.
Sure.
And get some answers from them as to when this program that they were chosen by the slimmest of margins to bring forward is actually going to, when the rubber is going to meet the road, I think is when we would like to know, what their plans are.
Right.
And, all right. So is that something that we can set up or
Happy to.
try and set up with St. Lawrence Health System?
Happy to.
Sure.
And at our next month's services meeting or before, it's up to you.
Okay.
Okay?
Happy to.
Okay?
Yep. It's my understanding that Eric Birch is no longer with St. Lawrence Health System, and I believe David Acker is the one that is, at least temporarily until Mr. Birch is replaced, is taking on the lead role for the OTP.
Great.
Any other questions? Okay. Mr. Rinaldi?
Could we get a very brief update on the mobile clinic? How's the status of the vehicles?
Yeah.
Did you hear that, Jay?
I did, yes. Well, that's a little bit of a precarious situation because we do not have a VIN number. So that means they don't have a chassis yet. And I'm assuming this is all COVID shortage related situation. So, and why that makes it precarious is we need a VIN number and a date of when the vehicle is going to be completed so that we can finalize, our budget with the SOAR grant. So they will not, for us to get an extension on the SOAR, we need a VIN number, and subsequent to that, we need a pretty hard date of when that is going to, when the build is going to be completed. So, I mean, we've been, sending very, very frequent emails to Matthews, the vehicle manufacturer, on that. So I cannot give you a specific timeline in terms of when that will be available.
Thank you.
When's the last time you were in contact with them?
Oh, I'm sure it was at least last week. Yeah, we have contact with them.
All right. So they don't give you any answer at all as to, an anticipated date or,
No.
nothing?
Well, I mean, we're still hoping by January or February of next year, but we've got to, we got to get a chassis.
All right. Keep after them.
We will.
Anyone else? Thank you, Jay.
All right, thank you.
County Administrator, the Vacancy Review Committee.
So annually, as I mentioned in our last meeting, I provide you with the update on trends and reflect on the year. However, what I recognized is I got a little ahead of myself. I typically do that at finance. So I spoke to Chairman Lightfoot. I will bring that to you next time. This time, just giving you an update on our meeting held August 3rd. We have 5 departments that brought forward vacancies from 4 departments with 5 vacancies, and 1 includes an abolish and create. And if it's okay with the chairman, I'll present for social services as well after public health.
Anybody opposed to that?
Okay. I think Jolene is with us still.
Okay.
Here she is. Hi, Jolene.
Hello.
Go ahead.
So this is a vacancy, or to create a new position for a public health specialist. This is funded through our school grant program, and it is a brand new position. It's not taking away from any work that the department already does. It is meant to help manage the school's COVID school screening testing program for the next year. So it is only for a year. It would end when the grant funding ends on July 31st, 2022.
Questions for Jolene? Okay. Thank you, Jolene.
Thank you.
So the next 2 vacancies are for social services. The first one is for Child Protective Services, caseworker. employed since 2019, has departed and looking to fill this one immediately. Questions on that? Okay. And then the second one is a computer technician from IT, the small unit of IT staff in social services. They have one individual who's transferred, and they're hoping to fill that position also immediately. No questions?
No question.
I think Mr. Burke does.
Mr. Burke? I'm sorry, on the caseworker one, I'm wondering, did we do a exit interview?
I will find out if that one was. I did get an update on totals for exit interviews since 2020, 28 have been done, and they should be accessible to you on Google Drive, but I'll find out if this specific departure did an exit interview.
You said 2019, the employee started.
Correct.
Yeah. That's a big investment.
For a short time period, you bet. And just as by way of update, I try to keep you informed how many overall vacant positions we have. Out of the 808, at least that were budgeted, there are 34 current vacancies that are either in the process of being filled or vacant at this time. And then the last we have is community services. Jay has one position. Go ahead.
Okay, we're asking for a fill for the program director for our mental health clinic. As you know, we have program directors for both the addiction services and a mental health clinic. So, you know, under my direction, the mental health clinic program director provides both clinical and administrative oversight to that program. This is a fairly big loss, you know, for the department. The person leaving did a very good job. Any event, if you look at the you know, the vacancy authorization form, you know, the type is very small because I was trying to, I had to cut a lot of things out in terms of what that individual did on a daily, week, and month-to-month basis. But certainly, you know, I feel that, you know, we need an immediate fill for this position.
Questions for Jay? And Jay, this position can be either credential, correct?
Correct.
Mental health counselor or social worker.
Correct.
Okay. Thank you, Jay.
All right, thank you.
Okay, what's up? Okay, committee reports. Board of Health, Mr. Akers.
We've meeting on the 17th of August.
Thank you. CDP Board of Directors, Mr. Sheriff.
No report this month.
Thank you. Community Services Board, Ms. Curran.
Thank you, Mr. Chairman. We do not have a meeting in August. Next meeting is September.
Okay, thank you. Office for the Aging Advisory Board, Mr. Denisius.
Mr. Chairman, nothing to report.
Thank you. Mr. Millie has left the room. Check with her when she comes back, and if she has a report, we'll give it at the Operations Committee. Any old or new business? Old or new? Seeing none, we have need for executive session that we will have at the end of the operations meeting.
Yes, sir.
A motion to adjourn by Mr. Smithers, second by Mr. Arquette. All in favor? Aye. Opposed? Carried. We're adjourned.
She's just sitting there for me.
CPH just met with them at the mall. Oh, I see how you are.
I'd like to call to order the August
Operations.
operations meeting.
Oh, sorry.
Can I get the approval of the minutes, please? By Mr. Fay and Mr. Forsythe. All in favor? Any opposed? So first up, we have, I'm sorry, the agenda. Sorry, normally I have a cheat sheet. I need to get people to approve the agenda. All in favor?
I'll take a motion.
Take a motion from Mr. Denisha, second by Mr. Smithers. All in favor?
Aye.
Sorry. First up, we have probation, Mr. Lepay.
Good evening, everybody. This resolution probably looks familiar. The resolution actually have to be
Rita,
Oh, sorry.
I want to get a
have
motion.
a resolution authorizing the chair to sign an alternatives to incarceration service plan contract. Can I get someone to move the motion, Mr. Perkins and Mr. Smithers?
So this resolution probably looks familiar. A few months ago, I brought a similar resolution, the only difference being the date. A month ago, the resolution was for the 2021 budget year. This one's for the 21-22 budget year. It took over a year for the state to approve the last one, based on because of COVID reasons. So I'm just asking that the board give the board permission to sign the grant. The dollar amount's the same as last year. Nothing's changed.
Any questions? Seeing none, all in favor?
Aye.
Any opposed? Okay, motion passes. Thank you.
Thank you.
Next up, we have human resources. I have a resolution authorizing the chair to sign a facilities use permit with the State University of New York College. Of Technology at Canton by Mr. Perkins, second by Mr. Forsythe. Go ahead, Jen.
Hi. So from time to time, usually a couple of times a year, Human Resources has the need for a large room to hold civil service exams for a large group of applicants. And we've been we have been using Canton High School and Canton College for many years. And so we do have a need coming up this fall for the use of SUNY Canton.
Okay, does anyone have any questions? Mr. Ray, go ahead.
What's the test for?
The one coming up this fall is going to be the agility test for the deputies and police officers.
Thank you.
Any other questions? All in favor?
Aye.
Any opposed? Motion carries. Thank you, Jen.
Madam Chair,
Yes.
we would request the next resolution be withdrawn at this time.
For information technology? Okay, so I can just go to 6.
Yep.
The next up is planning with Jason Thornhouse.
Good evening again.
I would move.
I was gonna do that, but I just wasn't going to say hi. So I have a resolution authorizing the chair to sign a contract with Usherwood Office Technology to provide a multi-function device lease and management program for St. Louis County. Moved by Mr. Akers, seconded by Mr. Forsythe.
Madam Chairwoman,
that's the one.
the next one down.
That's the one.
Oh, that's always
Yep,
correct.
yep.
Okay.
Sorry about that.
Sorry about that one. Okay, so we have a resolution modifying the 2021 budget for transit and the planning office for public transit shelters. Moved by Mr. Perkins, seconded by Mr. Forsythe.
Great, thank you very much. The first thing I would like to do is to change the title. The title has a reference specifically to public transit bus shelter, which is part of the resolution, but it's not totally what the 147,175 is going to be used for. So the request is to change the title to modifying the 2021 budget for the planning office for public transit. And what this is it's $147,175 to purchase bus equipment, which includes an audio system for the fleet to allow for the announcement of stops. As the driver comes to a stop, they can announce where they're stopping, similar to what you hear in a subway system or a larger public transit system. It is an ADA compliance issue, so we're grateful for the opportunity to put that in the fleet of buses. The other use for the funds will be for some shop equipment for lifts to help maintain the buses, to lift the buses, to do maintenance work on them. And the last amount is for bus shelters, including the shelter at the Harold B. Smith building across the street here. You may have noticed some work being done over the last year or so. They've moved the driver's test stopping area from in front of the Smith building over to Court Street over here, just to reduce some of the congestion on that part of the street. They've also striped it, so there are 3 distinct lanes now, a separate lane specifically for the buses to pull over, just helps improve safety and safe passage for the traffic, the two-way traffic on Judson Street. The bus shelter itself will include a concrete pad and then the structure that will be built in the near future. So that is the gist of this resolution.
Any questions?
So currently, a motion is needed to change the title. Is that
So we can make that adjustment. Yep.
Anybody else? Seeing none, all in favor?
Aye.
Any opposed? Next, we have the lead grant update.
Thank you. Last month, I gave, I guess, a little more comprehensive overview of the program, so I won't go into any of that detail again. I just wanted to give you updated, I guess, progress since last month, but now, I guess. We have had one additional application received for the program. An additional bid package was sent out to contractors, and one more project is under construction. So again, slow but steady progress there. We also had a pretty, I don't know, enlightening or revealing or a discouraging conversation with HUD last Thursday, August 5th. There was a regional call for all recipients of application of these lead grants in the New York, New Jersey district, and it was really it's discouraging to hear that every comment that was made was similar to the problems and concerns, challenges that we've had with our grant. Specifically, the cost of materials, the delay in getting materials, the lack of contractors. Is something that is being felt by all recipients of this program in New York and New Jersey anyway, and I'm sure further across the country as well. But it was helpful, I think, for HUD, the HUD officials. The director of the program was on the call and was understanding to the concerns that the recipients have, shared our frustrations. Was willing to look to modify the cap, $20,000 cap on these projects because of the material costs going up so much. I would not commit to doing it directly, but would look further into it, which it is, I think, a positive thing. And also, there was some discussion about willingness on HUD's part to move benchmark milestones and also contract end dates, which we are still well within our contract period, but we and hope to obviously complete the grant within the initial timeframe. But that was comments that were made by other recipients that we just can't get the work done because of the challenges that are before us in the time allotted. So not great news, but hopefully with the amount of concern that was raised by all the recipients, that there will be some flexibility at how to help this project move along.
Any questions? Seeing none, about a broadband survey discussion.
Oh, I'm sorry.
Nicole, I didn't see you.
It's okay. I'm just wondering if it would be helpful if the other counties that are facing these same hurdles had a resolution, like a resolution that's passed and forwarded on to show support for movement on this project, or some leverage to have some breathing room so that the project is successful. I'm just wondering if that's something that you think may help, or that we could lobby for, or work through with NISAC through to help with.
And certainly, I don't think it would hurt. I think that's a great idea to reach out to NISAC for the New York State counties anyway. There are a number of counties that have received these funds for many years. Others that are just new to the game, like St. Lawrence County. So NISAC might be a good arm to sort of pull all of those counties together.
Anyone else? Seeing none, on to broadband survey.
Okay, thank you. Broadband, as you know, there's some funding that the board set aside some months ago to prepare a broadband survey and inventory study. That information is now in it is, I won't say it's complete, but it's ready for review. So we are meeting with the consultant next week. The Development Authority and county staff are meeting with the consultant to put the information together next week on the 19th of August to sort of go through the document and just review it, make sure that everything that is understandable, that we hope was in there is in there, and to sort of help us understand what is there. Then obviously we would like to bring it to this board for a presentation to you for your consumption. So I'll be speaking with the county administrator about what time frame we'll be looking for that sort of presentation.
Mr. Reagan?
When you're talking to the consultant and when you're talking today, I think on a regular basis, people around the county reach out to various offices and representatives to raise the point that they don't have access to broadband service and they want it. And, you know, they may or may not have been included in the survey. Will there be a way that we can, you know, when we're approached by people who are not served now and who want service, to get them brought into the survey so that when there are grants done in various areas of the county, that the survey can be updated on a regular basis?
I can certainly bring that up with the consultant to see if there is some flexibility to continue that sort of relationship. The survey had a specific start and end date, with the understanding that wanted to gather as much information as could be gathered, but you're absolutely right. There's always going to be changes, or people move to the area, or different situations.
You know, my point is, the survey was done in conjunction with the Development Authority of the North Country. And they approached us about working together on this. So it would seem that if there's, there could be an Excel format that would allow these names and addresses and other information to be added, and that we should make clear today that regardless of what happens with the consultant, that we expect them to be accepting new information as it becomes available, and as grant source funding becomes available, that they, you know, include these neighborhoods so that eventually we get the broadband service where it needs to be. And you know, on a regular basis, especially during this COVID, a lot of people have moved their primary residence to rural properties that they own, thinking that, oh, it will be a very simple process now for me to get the kind of broadband access that I'm used to having, only to discover that, oh no, you know, there is no broadband service available to you there. And it's not coming anytime soon that anyone's aware of. And, you know, they're going ballistic when they discover that. The other thing is, the state has a Office of Broadband Service that you can put in an address for anybody, you know, and find out what is nearby. And in many cases, there's satellite service, but of various, you know, levels, 25 to 100. And in many cases, the people who are living in these areas are not aware that they've got the 10 megabyte one, but there's also a 100 megabyte one available to them. And, you know, that, you know, we need to find out ways of making that known to these people as a interim measure.
Sure. Yeah, good point. I'll certainly bring that up when we have a discussion.
Thank you.
I asked the question, who's gonna pay for this? We have a contract with somebody, they performed their work, presented the problem, and now you're asking them to do more?
You know, I asked this, this question back when we had this discussion about it, and I believe that we were assured at the time that they would be addressing this. So I want to see if it's being addressed.
Any other questions? Seeing none. Thank you very much. Next up, we have the Board of Elections.
Evening.
I'm here. I just don't have my camera on due to lack of service.
I have a resolution modifying the 2021 budget for the Board of Elections for the acceptance of the cybersecurity remediation grant. Moved by Mr. Perfect, second by Mr. Smithers. Go ahead.
This grant, we accepted the grant, and this is
just modifying our budget for the cybersecurity modifications. And really, IT has established a lot of where we need to spend these monies to establish the best cybersecurity protocol for our department.
Anyone else have anything? No?
Yes, Mr. Johnson.
Mr. Johnson, do you?
Good evening. Yeah, I'd be glad to address. So an audit was done. The New York State Board of Elections sanctioned audits to be done all over the state, cybersecurity audits. They then appointed a group, NISTech, to liaise with counties, with all of these counties, to basically take, so every county was given a very specific piece of the pie, a pot of money, and then that was placed against all of the specific vulnerabilities and recommendations found in that audit, and worked step by step. I and Board of Elections personnel worked step by step with these people to specifically identify and address the concerns raised in these audits. And then we came up with a plan which was submitted to the State Board of Elections. They approved that plan, and this projected spending is the result.
Okay. Thank you. Mr. Nichols, did you have anything to add to that?
No.
No? Is there any questions? Mr. Forsythe?
Yeah, I see a small part of this is supplies, most of it's this e-service hours. What is e-service hours?
The a big piece of this, there are two major pieces to this. One involves something called the network segmentation, which basically sets the piece of network that the Board of Elections staff is on apart. Kind of gives them, I mean, we've got pretty good protection countywide, but this makes it even greater. Kind of from the difference between a medium and a maximum security prison, perhaps think of this. And in order to effect this, there was equipment put in, but there then is a company who configures and installs that equipment that remotely monitors and checks for things going wrong. That's what that's related to. The second piece of it involves the creation of both an incident response plan, which basically says if something bad happens, here are the break glass, do these things, and the second is a disaster recovery plan, which when something bad happens, step by step, here's how we get things operational once again.
How long does that last for? A year, 2 years, or like the software?
The costing was done on a bi-month basis. The proposal pays for over 2 years of service, and then so this is as off the case with grant things that we buy with a grant. On the other side of it, when the grant runs out, if we want to continue, the county will need to determine whether we want to do that and then to fund it, whether it's through other grant monies or other sourcing places. The incident response plan and the disaster recovery plan is it's a plan that should be looked at and updated, but it won't. Keeping it updated isn't as great a cost as to originally do it.
Okay. All right.
Anyone else have any questions?
I just want to mention one minor thing, if it's not possible, Madam Chair.
I'm sorry?
I just want to mention something that this really draws the point up that the New York State and the county boards of elections are very serious about making sure that people's votes are protected, that the system is protected, and that it's not going to be at all easy for anybody to try to hack into the system or to manipulate with the votes that you folks depend on. And that's our primary focus, to make sure that you folks can rest assured that when the process is over, that it was legitimate, that it's accountable, and that nobody got into it in some fashion. And this grant is just one part of that, but we spend a lot of our time in the office just going through different aspects of the entire system, so that not only are the ballots that we purchase are protected, but also the machines, the way they fit into them. There's a whole protocol that people need to know is out there to protect you, the voter, so that when we're done, we all do feel good about the elections, no matter who wins or loses.
Okay. All right, thank you. All in favor? Any opposed? Okay. I have a resolution proclaiming September 4th, 2021 as National Wildlife Day in St. Lawrence County. Moved by Mr. Forsythe, second by Mr. Sheridan. Any questions? In 2005, Colleen Page declared National Wildlife Day just to bring an understanding and some attention to the fact that we have multiple different, animals in our country that are endangered, and so people think about it. Okay, all in favor?
Aye.
Any opposed? Next up, we have committee reports. Agriculture and Farmland Protection, Mr. Denisha.
Nothing to report.
Okay. Alternatives to incarceration, Mr. Birch.
Nothing to report.
Board of Trustee of the Supreme Court Library, Mr. Piacco. Emergency Medical Services Advisory Board, we did not meet in August. Next one is in September. Environmental Management Council, Ms. Turbinelli.
Thank you, Madam Chair. So we met on July 21st. Our presentation was from Suzanne Powers. She is the Spence Professor of Sustainable Environmental Systems and also the Director of the Institute for a Sustainable Environment at Clarkson University. And she presented on food waste, and the purpose of her presentation was to increase community awareness and stakeholder engagement in order to develop a plan for community-scale food waste management. And they're specifically, right now, their focus is on the Potsdam area. They have a local farmer that would like to do some food waste collection. And this is in response to the legislation that will be coming that's going to require businesses with 72 tons of food waste per week that they have to donate to an edible food waste or recycle it if there's something within a 25-mile radius. So this is a grant-funded project in which they're just trying to get the kind of like grassroots food waste, composting kind of locations. She talked a little bit about the compost program that they have in Onondaga County right now. So it was very interesting, and it is kind of grassroots, just getting the ball rolling and really just engaging the community and creating awareness about food waste. I was shocked with 40% of food is wasted, and 1 in 6 people are food insecure, meaning they don't have access to the food that they need. So we're wasting, and there's people going without. So just to waste, kind of repurpose and look at how we can be more conservative, and if we do need to waste, that it's going somewhere, food pantry or something like that. And of course, with that comes an education component. And that's about it. We looked at the resolution that was brought forward, so that was part of our other discussion with the Black Lake situation and the watershed management plan and the financial assistance for this year to get the milfoil cleaned up. So that was part of our discussion, but we saw that resolution last week. And they're continuing to work on gathering information about fish bypass options, not just in Madrid, but what some of the other local dams have done or could consider doing, and providing maybe some recommendations to communities based on their research. And a lot of that goes with the planning department. They work in tandem. Our next meeting is August 18th, and it's our annual at Washington Beach.
Fire Advisory Board, Mr. Denisha. Oh, sorry, Harry, you have a question?
Those percentages that you gave on food waste
Are those for the United States?
Or locally? That's a good question. I'm not sure what it's specific to. I would assume that the data would be nationwide, only because I don't know that we've had that data collection system locally within St. Lawrence County, but that's just a purely assumptions.
Okay, Mr. Reagan, good question. Sorry.
The news that there's water chestnuts in the Oswegatchie River is extremely disturbing. And, you know, most people aren't very familiar with water chestnuts, but they can pose serious problems to bathers, to swimmers, to others, you know, far in excess of milfoil. I think it's imperative that now, when the problem is just emerging, that we ask the Environmental Management Council to take a look at this, because if it spreads, and it has a tendency to spread rapidly, it can pose serious problems as it flows through the Oswegatchie watershed and stretches into other townships that border the Oswegatchie, and gets into the St. Lawrence, gets into swimming areas in Lisbon, Waddington, Louisville, all the way, you know, to the dam. Now is the time to address that problem and begin planning for, you know, how we're going to do that before this becomes a problem and we have towns across the county wrestling with another major invasive species outbreak that can cause some major problems for our shoreline communities around the county.
Anybody else? Next, we have the Fire Advisory Board, Mr. Denisha.
I'm sure we have nothing new to report from the Fire Advisory Board, but I do want to make a quick report on the St. Clemens County Radio Committee, which is with the Fire Advisory and AMS. We had our initial meeting on July 28th, and just run down the folks that were there. Myself, you were excused, Tony lives there, Craig was excused, Chairman Sheridan was there. From Emergency Services, we had Matt Denner and Jonathan Mitchell. St. Lawrence County Fire Department, we had Bob Crow and Matt Hannibal from Bob from Canton, Matt Hannibal from Harrisville. And the St. Lawrence County EMS reps, Mark Evers from Government Rescue Squad, and Matt McDonald from Ogdensburg Rescue. And St. Lawrence County Law Enforcement reps, our Undersheriff Sean Bryan was there. What we looked at was essentially what do we have currently for a radio system, what do we want, what do we need, and what can we look to report. And there was some very good dialogue. Comes down to the current issue that we have is the lack of capacity and capability with our current system. So we are going to have Blue Wing consultant who's helped us through with our radio services for quite some time, and they're going to be at our next meeting, which is August 11th at 6 p.m.
Any questions on that? Seeing none. Next up, Inter-County Legislative Committee. So they brought forth a resolution in support of rescinding the New York State fiber right-of-way fees that are imposed, suggested by the Senate bill, and assembly bill that they put in there. And I was kind of waiting, I sent a question down to see, it appears to be for occupancy fees for fiber cables. And I didn't know how that was gonna affect, but I did send a question saying there's like Slick and other places that are fighting being taxed to be in that right of way. So I wonder if this legislation is somehow gonna affect that and what their thoughts were. And then they had sent a FOIL form around that I sent to you.
Yes.
They wanted information on, I couldn't find it.
Medicaid, the holdback from the state.
Yeah, the holdback from the state and where everybody was with that and just when we were gonna get that. And the next meeting is the end of August. Any questions? Next up, the jury board, Mr. Sheridan.
Chairman, the jury board has not met.
Mr. Fay, the planning board.
Our planning board July meeting was reported with the July operation meeting. Our next planning board meeting for August is Thursday.
County administrators report.
Okay, so the first item I wanted to go over with you this evening is the potential renovations that the Buildings and Grounds Committee has been taking a look at. There have been, I believe, at least 4 meetings based on the discussion about initially what was driven by a need to address the dispatch center and the antiquation of the space in that area, as well as room needed for new technology. So as you've heard through a variety of resolutions recently, we're looking at both a new phone system, a new radio system, and connectivity with our new towers. So that prompted what logically would be a greater conversation about the public safety complex. So what I was hoping to go over with you tonight, you all have versions of the latest draft of all 3 levels in the public safety complex. So just to go over briefly who currently resides in the, oh, we don't have enough? Does everyone have one? My apologies. Okay, good. So currently you have on the first level, the sheriff's office, emergency services and the dispatch center, and you have the New York State Police who leases space from us. On the second floor, you have the sheriff's civil office, the sheriff's detective division, and the sheriff's, and then you have planning and you have the conflict defender's office. That's the current residence of the location. So, start with the basement. So starting with the basement, which currently has segregated areas for the state police, for emergency services, and for the sheriff. So they occupy the totality of the basement area. What you're looking at on this first page is a reorganization of the sheriff's area. And at the bottom left of the drawing, some of you may have been down to what was formerly called the cafeteria, but has been converted to a very nice conference space that the sheriff makes use of and shares essentially with anyone, but certainly with the occupants of the building. And so in that area where you see wiretap room written, very small, is currently the former kitchen, which is no longer used. So it's a former setup, a traditional kitchen where they used to make meals. That formerly, if you aren't familiar, was a bunker. And so what the proposal here is a relocation of the current second floor wiretap room to this location. And during this process, we learned that we had some federal folks make a visit here and take a look at our wiretap room, which they identified not having it in a location where there were no other personnel on either side of it was not advisable. So what we would like to do is relocate that room downstairs off of that new conference space so that if there was a need to conduct what that room is function and designed for, you'd also have a work area adjacent to it. And that was found to be an advisable location for the wiretap room. So that's the first area of renovation proposed. Secondly, we would be looking at relocating the detectives to the space at the top of the drawing that you see there, identified as very small. Detectives with the square feet. So overall in this area, it's about 800 square feet we're talking about being renovated. This would provide for 3 detectives and a sergeant to locate in this area. It would provide an opportunity to have an interview room in that area just to the left of it. But also you'd have the sergeant separate from the area where the detectives would be working. And that's somewhat of how they have it set up at this time. So that relocation frees up some space where they currently occupy on the 2nd floor. We also, at far left of that same drawing, you see the Racy's room. That is relocated. It currently has a space, and Racy's is the radio folks that we have created space and maintained space for, I believe, as long as they have occupied that building. So we would relocate the space, bless you, for Racy's to continue to have a space to store their equipment, and I believe staff are infrequently in the building. Any questions on the basement area? Okay, so moving on then to the 1st floor. Currently, the area you see shaded there is occupied by emergency services. And so the hope here is to take the sheriff's civil office, which is located on the 2nd floor of the building, the length of the building, and bring them downstairs into the emergency services suite. That would make the sheriff's office, road patrol, and the civil office adjacent to one another. So all of their operations at that time would be on the same floor for the road patrol with the detectives in the basement that we just went over. So what this drawing in its current form provides is an opportunity to resituate the customer service or public-facing window. When you currently enter the building, for those of you who've been over there, you enter the building to a window and you walk to the left over to the dispatch area where you are greeted and served by dispatchers, who certainly you could make an argument shouldn't be interrupted from their work to wait on the public coming in. So we thought carefully about how we might deal with that, moving them out of the 1st floor, having them away from areas where the public would need to be served was a priority for this project. So in doing so, we still need an area for the public to come in, and we still need an area where the public can be served. So the civil office already serves the public in accepting payments and agreements with those who they are either performing income executions on. A number of procedures and processes occur with the civil office. So that gives them an opportunity both to greet and meet the public, but also to have their clientele who come in no longer have to go up to the 2nd floor. They can be met right at the door. There you have the 4 location for the staff who work in the civil office. As you may recall, the sheriff's been transitioning over as civil positions become available over to road patrol deputies. So they're being given the civil assignment, but they're full officers in that capacity. So they would be situated there. We would maintain the kitchen area, which currently serves the dispatch and occupants on the 1st floor, modify that a bit for and upgrade the service or the appliances there. Also provide file storage and a break room. This break room would be available for the road patrol deputies who come in, as well as the civil staff who occupy that space. And then you go on back to the existing space. So we would not have renovation costs in the back area here. To the extreme, we would in the front area. The offices at the back or the bottom of the page already exist. So that would provide a location for the principal fiscal officer and for the supervising or civil deputy who supervises a civil unit. So there is, I think on the front end, considerable renovation to the former dispatch area to make it functional for civil staff. But what also was important, I think, is to look at the dispatch room and to put new people in it. It would always be a dispatch room. So we thought we would take the opportunity with respect to where the stationary posts and areas need to be maintained, but also reduce the size of that to have a more welcoming entrance to the public safety complex. Any questions on the 1st floor? Also, just to mention, the civil office staff is on the road quite a bit as a part of their duties. This would give them their own entrance from the back, which currently is accessed by emergency services staff. So currently they come in the building, they go up to the second floor. This gives them immediate access from the parking lot of the public safety complex. And this is approximately 2,300 square feet. Okay. And then the last and certainly the largest renovation that we're looking at is on the second floor. As I mentioned, that currently hosts the planning office, conflict defender, and the sheriff's civil office. So when you're looking at the drawing in front of you, the latest draft, on the left-hand side is where planning and the detectives currently occupy. This would be converted for the district attorney's office and staff. So we have a district attorney who is interested at this point in having adjacency with the law enforcement agencies in the county. And we think this is a great opportunity for the synergies there to be provided in one building. This provides offices for all of his attorneys, all of the clerical staff, as well as converts the current public safety conference room into the grand jury room. So that would take it offline for public purposes, except when grand jury is not in session. It provides an opportunity for direct access, again, from the rear of the building for certain types of folks who need to come in and testify for grand jury, as well as grand jury members to come in the front of the building and go to the conference room with ease. So the department staff can access from the back, and as most of you are familiar with, there's double entrance to the conference room at the front. This provides an evidence room. It also provides a witness room and a number of needs that aren't easily met in the bifurcated space they currently occupy on the second floor of the main courthouse. So this would provide an opportunity to have all of our law enforcement agencies in one building. So then across the hall, where currently the conflict defender is occupying, as well as the civil office, this would be the proposed new 911 center, or the dispatch center. So at the bottom of the drawing, what you're seeing there outlined in white are the dispatch consoles, they're called. So what we would propose in this scenario is that 6, we currently have 4, would be immediately ordered and installed with the availability and space to grow to 8. We wouldn't do that at the current time, but it would provide opportunity for growth with the long game of taking a look at where services may go in the future. However, also understanding that there are a number of monitors, there's a number of equipment that needs room in that space that would give an opportunity to have monitors along one wall so that all dispatchers could see the information at the same time. Currently, they have a rotation. I think the chair is well familiar with the dispatch center. So this would, I think, align the services that need to be provided with the technology that we're looking to acquire. And some of this is going to be paid for, both the renovations as well as the equipment, by the $6 million grant that you've all been made aware of over these last few months. So in short, that would be our new dispatch center. And then coming through that, on the right-hand side of the shaded area, you would have the supervisor of dispatch, the deputy director, and the director's offices along the hallway. Then you'd also have a new EOC location. Many of you are aware we currently use this room as our emergency operations center. And in some ways it meets the needs. However, they're looking at potentially creating an EOC across the street. They would have immediate access to all the information coming in and potentially be a better fit. However, also have offered, in losing public safety conference room and potentially down the road losing our public safety and our 226A and B in this building, this potentially could be available for use by departments like we have shared conference room space. So very limited times, much like this room we use for the EOC, it would be available to meet the needs of groups that needed to get together. I think they've got 12 in this location. So arguably that's one of the best locations in the building, and that would be available for shared use amongst departments going forward, as well as state police or any occupants in that building. So it also allows and provides for a kitchen for the staff who have to work in that area. It provides an area for the receptionist, and also provides that public access coming off of the larger hallway there. And then we're looking at, in general terms, across the county, but certainly with this project of putting in touchless toilets, sinks, all those types of upgrades, we just haven't done yet, or we do it as they break. So this would give us an opportunity to upgrade some of those types of things, certainly mindful of COVID, but that's where technology, I think, is leading us also. Are there any questions about the second floor?
Is the total cost $6 million? Is that what you're saying?
It is not. What I'm saying is the grant we received has a very minimal portion, less than 100,000, that could be used for the physical renovations. I think we're all well aware of what costs look like associated with renovations at this point in time. The $6 million is for the radio system, the communication system, as well as to help with our towers.
Where's the conflict defender go?
The conflict defender, so the homeless, conflict defender and the planning office would move over to the courthouse with the intentions that planning would return to the place they formerly occupied, as well as the conflict defender would be located in the original district attorney's office space, which they both can fit into those locations. So everyone ends up with a home.
This has freed up, well, you answered it in part, frees up additional space over here. That conference room, I think it used to be 226.
Yes.
Is that going to be freed up?
So initially it would be, because grand jury would move and use this location. However, our anticipation with some of the conversations about family court and their needs may obligate some of that space in the future. Are there questions at this time? Mr. Reagan does.
Would it open up enough space for a second family court if we had to have one?
We are looking at how that might work. We've looked at both the first and the second floor and tried to figure out where the adjacencies would make the most sense. So it's possible, depending on the needs.
Thank you.
So in short, wanted to go over at least where we are with the draft at this time, make sure there are no major objections to us moving forward. Thus far, we have spent just under $11,000 on the drawings attached to each level of the public safety complex. I would not at this time venture a guess at the cost of these with everything that we know that's going on in the market. However, what I would like, if there's no objection, is the permission to move forward to get those numbers for you. And so then you could make an informed decision. We could also gather any grant funding that we potentially have available or would like to seek for this endeavor so that we could quilt, if you will, a package of how to pay for the renovations at public safety.
So file space for the DA, I mean, that was an issue over here. Would they still be accessing their files over here now?
They have files in just about every building we have. So we would work with them on the best management for that. They have files in the warehouse, they have files in the jail, they have files in their office. So we would certainly work on a solution and bring that to you with regard to maintaining and accessing their files.
So their answer is no, there is no file space here.
Well, in their space, they would have the normal daily access that they have now. But we'd have to figure out, the excess, where that would go and how they would manage it. You're welcome. Other questions on this? So more to come. We just wanted to make sure in vetting this with the Buildings and Grounds Committee that this group was aware. Certainly many of the conversations about dispatch, I think, fold into some of these conversations and how St. Lawrence County primarily has to look out for the county as a whole and look at where we go in the future with our technology in the 911 center.
Yeah. As chair of the Building and Grounds Committee, I would like to suggest that we give permission to move forward and get, we don't get the cost analysis.
Second.
All in favor?
Aye.
Anybody opposed?
Okay, just a couple other items to give you an update on. With regard to COVID-19, certainly mindful of the conversations with our increase in numbers. Just a quick update on some of our neighbors and then some other counties not so close who are taking alternative actions. Wanted to make sure you were aware, and I think it was mentioned, Lewis County has moved to that substantial transmission and they've returned to masking indoors. Franklin County began that today in their DMVs, and they will also, where social distancing can't be achieved, they will be masking in their facilities as well. Also, counties like Monroe, Cayuga, Erie, Broome, and Onondaga are taking up masking indoors as well. Ulster County is the only county that I'm aware of at this time who has implemented the vaccine or test. So we'll reach out to them and see how they are managing either the cost of that, who's bearing that burden, to see how that process is being implemented. Certainly on the testing side, lots of questions about that. We actually were approached about, you may recall, the Binax Now test that we had and we're sharing with the school districts. Those at this point have all expired. And I don't believe that those were the tests that we were looking at using. I just want to give you an update on that. So we had 3 school districts last year through the surveillance program who accessed these tests free of charge, and they conducted a testing process in schools. We will be talking later in the week with the schools again about the testing component and the funding with that. But from our perspective, there aren't tests immediately available. And as everyone moves in this direction, I talked with Jolene today a little bit about the idea of perhaps acquiring some tests in the near future, as I imagine that will be the next thing that's difficult to acquire. So we'll keep you posted on that. As she mentioned, we're not in substantial transmission, although she expects so with the numbers that were reported today. So our expectation is that that will be where St. Lawrence County will be by the end of this week. And we're talking about making that recommendation, moving to masking indoors, regardless of vaccination status. And again, when social distancing is not possible, but also for all types of client contacts. As you know, we have folks who are out in the field working, they're going into homes, things of that nature. So we're looking at those. We'll monitor when we move to that substantial transmission and keep you informed. Any questions on that at the moment?
Nicole, sorry, can I ask just to clarify, because I was looking on the CDC's COVID dashboard earlier today, and they do have St. Lawrence County as substantial, effective Monday, August 2nd, actually.
Okay.
They're listing us as substantial.
Okay.
And just to update, I know SUNY Potsdam sent out an email earlier today that at least the first 2 weeks of classes, they will be required masks in all of the areas.
Thank you.
So in England, there's things happening in England before it happens here. The Delta is already moving down. And so the expectation is that we have hit the high peak here, but it will actually be lowering.
Is there anything else?
I do, but I think there's other questions maybe.
Mr. Burke.
Is there any point that we would consider remote working?
Certainly something we still have a pending action outstanding on, and I can give you an update on that.
Anybody else have any questions? All right.
Okay, a few other things, an update. A few weeks ago, I gave you information via email about some storm flooding damage that we sustained both to the courthouse and to social services. What we have discovered in the courthouse area is that we have some stormwater management challenges in our parking lot, and that comes off of Court Street here into the parking lot around the back. So we're investigating the challenges we have there, but we believe it's been quite a bit of time since there has been attention or updates provided to that stormwater, which then moves around to Judson Street and out to the back to a sewer back there. So that may be a project that I may bring to you so that when that water comes off of Court Street, it's not coming into the courthouse, which is where, as it backs up, it ends up coming in and ending up in our basement in our department. We did have an update. We lost in social services. We lost 10 computers, 22 monitors, 22 keyboards, and 22 mice or mouses, however you refer to that. So we're looking at those replacements because that area now has been repaired. In our most recent storm, we did not see water damage there. However, in the courthouse area, we did. So those areas, at least at this time, aren't seeing additional impact from any additional storming. Next item is there was a discussion about a work session to be held to educate legislators on our cybersecurity efforts. I did talk with Rick about that, and we're going to look at September to schedule that. It won't happen in a committee form that's broadcast, but it will happen, and we'll make sure you have the date. So if you'd like to attend either virtually or in person, you can do that. Did want to mention, unfortunately, we neglected to carefully study our schedule. NISAC is occurring at the next scheduled board meeting. So NISAC is scheduled the 13th through the 15th, and our board meeting is scheduled for the 13th. So we are looking at our options. The group that is asking to attend NISAC could assemble, myself included, to attend remotely. If that is the pleasure of the board, or however each individual would like to handle that, I believe we could post the address and I'll do all of the things we need to do so that the body could be whole while the meeting takes place. So I did want to mention that. On Wednesday, I'll be meeting with the Development Authority. My hope is that Chairman Sheridan, Vice Chair Denisha, and hopefully Legislator Smithers could attend. This is to assemble to review the materials recovery facility. As you may have seen, Dank was doing a study on the current distribution center in Harrisville to determine if they would like to place a MRF there, because recycling costs currently for St. Lawrence County are through Recycle America and Liverpool are extraordinary. You've seen the budgets. We've had lots of conversations about the challenges. So we'll be meeting on Wednesday in Governor to have that conversation, review their study, and look at next steps. So if you're interested, let me know. We can make the details, we can bring the details to your attention. And then last item I have, unless there's questions, we just concluded World Breastfeeding Week, and I share this with you. This was last week, August 1st through the 7th. I share this with you because Public Health has also provided lactation stations. Through some funding they received in a grant. We have 7 of them. There are 2 placed in DSS, 1 in Public Health, and 1 in the New York State Police area. So we have 3 more, and we're hoping to have those placed in each building when we're done. So fun fact for the evening. Any questions?
Seeing none, we need to go back for a moment to committee reports because Ms. Shermanelli did not get to talk about the youth advisory report.
I apologize that I was not paying attention to the agenda and stepped out of the room for a moment. So our last Youth Bureau meeting was on Thursday, July 29th. And just some of the highlights, OCFS emailed as of July 19th the final 2021 allocation amounts. And so $106,456 was granted to the county. The summer Youth Bureau interns, 6 of them, started the second week of July, and they're working, as Ruth had mentioned at our last meeting, on revamping the county tours. So they've been busy conducting meetings with the department heads to gather some information and highlights, as well as working on a newsletter, doing some social media content, and then researching to implement team-to-team peer mentoring programs. We do have, I had mentioned the face mask award that we had received at the last meeting. Suicide Awareness Walk has been set for Saturday, September 25th at Remington Trail. No time yet. I will update you that when that comes through. And that's it's for National Suicide Awareness Month. And then the RFPs for the Youth Development Program, the application window closed for that on July 30th, and as of the 29th, we had received 8 applications. The allocation committee members are working actually on Wednesday to review those and make decisions on those. And then we do have, I mentioned at my last report, we do have 3 openings for the Youth Advisory Board. So if you know anybody that would be an asset to that board, please get them the bio data sheet so that they can submit that and get it sent back. The Connecting St. Lawrence County Youth Services Conglomerate Group, Coalition, Collaborative, whatever you want to call it, to promote cooperation and collaboration between youth programs and services. Their next meeting is on Tuesday, September 14th at 2 p.m. If anybody is interested, or again knows anybody that is interested in participating in that group. And then our next meeting is the 26th at 3 p.m. And next youth committee meeting is the 18th at 1:30 p.m.
Do we have any questions on that?
No. Thank you for allowing me the opportunity to report.
Sorry, I forgot the first time.
It's okay.
You have anything else? Any old business? Any new business? Mr. Akers,
I have a
first.
question for the county attorney. Last week, was an article in Watertown Daily Times concerning the town of Messina and workers' compensation. It was my understanding that the debt for 2020 was paid in December, and then we're starting a new bill. And I thought the assessment for that on the sheet, the resolution we passed, that Messina bill was $200,000, but yet the articles suggested $500,000. Could you
Sure.
make sense?
The back that was for 2020, but the assessment for 2021 was from the July apportionment that you adopted in 2020. The 2020 bill was adopted in July of 2019. So for 2021, which was adopted in July of 2020, it's approximately $800 and some odd thousand that they owe. They still have a balance, if I recall correctly, of about $778,000. It's my understanding we're supposed to be receiving a check sometime soon of approximately $500,000. Next year's apportionment, which was just recently adopted, is significantly less. Next year is the first year in which the hospital's payroll and the hospital's insurance rating codes are taken out of the town of Messina's apportionment. And I think you're all aware they saw about a $700,000 drop as a result of that coming out.
So thank you for clarifying, because I think the bill for 2022 would be $200,000.
I think it's actually less than that.
Okay, Mr. Lightfoot.
I'd like to ask the board's indulgence and ask each of you that when you are visiting your town boards, that you speak to those supervisors and council people about the issue of the invasive species in our waterways. And it's been brought up tonight, it was brought up at the board meeting, and we have a problem on our waterways in St. Lawrence County. Two of those areas are within the area that I represent, even though Black Lake has, I think, 5 townships surrounding it. We need to take the lead, the county needs to take the lead, and I don't mean financially, but I mean getting together a group, organizations, people, the DEC, to go to the colleges and try and see what we can do to try and get somebody that has an environmental science department to take a look at these infestations. And so far, we've got milfoil and we've got chestnuts. God knows what else is out there. There's got to be a better way of dealing with this or these infestations than chopping them up and sending them downstream. That being said, I would ask that when you are attending town meetings, or speaking to anybody on those town boards, to identify any lakes or waterways in their area that have any infestation and what it is. I'd like to have that information because I think that my thought is we need to get something going on this. And I tried to start the ball rolling here with planning, with the EMC, with the Black Lake Association, and I think getting a handle on where these infestations are occurring and to what extent and what they are would be important in getting people that have the knowledge and the ability and the know-how to address these issues, not by chopping it up, but listen, if we've got to import a moose or two, we import a moose or two. But if you would do that for me and get that information, just email me, the location, what the infestation is. I appreciate it because I'd like to bring this to the DEC and to the federal people and explain to them that this is no small thing. It affects a huge part of the economy of St. Lawrence County, and we need to deal with it. And letting it go is going to make it worse. So no time like the present. If we can do that, get those statistics and locations and get interested people together, hopefully we can come up with something.
Mr. Forsythe?
It's a noble effort, but it's a tough one right there.
I realize that.
The St. Lawrence River, zebra mussels originated, the gobies from the shipping supposedly. So they changed the ballast of the shipping and the way the ships discharge their water. We're conducting fishing tournaments on just about every body of water now. Black Lake prides himself on bringing people from western New York, Pennsylvania, boat after boat after boat. It just goes from one spot to the other, from one spot to the other, and then you get the birds in there, they carry the fish, it drops it into the next pond, and it's just an endless cycle. So unless there's a way to get rid of this stuff, I don't know.
Well, that's what I'm hoping. I'm hoping that you get a place like Cornell or Clarkson that has the ability to put science to work. I think that that's the way to do it. Obviously, these worms that Legislator Smithers brought up, I forgot exactly what they're.
There's beetles.
Weevils. Yeah. Somebody said we ought to import moose to filter water and eat all that stuff. There's gotta be a better way of doing things. If we don't do something, it's just gonna continue as is, and, listen.
Well, it's an economy. That's gonna jeopardize our economy.
So if you could get that information to me, if you could make those contacts, it would be invaluable to be able to bring it to universities, whatever, to see what we can do to get a handle on this.
Okay.
Thank
you. Mr. Reagan?
Yeah, I would just like to urge the planning office and the Environmental Management Council, which is our advisory body on environmental matters, to coordinate this and work on this to help develop a comprehensive approach, because I think, all we're doing is very piecemeal. We have not set this as a major priority of the county, and we need to focus the attention of, and I think Legislator Lightfoot's thoughts on bringing the colleges and involving them. Clarkson has a Great Rivers Institute as part of its programs. There are environmental science programs at most of the colleges. I think bringing them in and getting them to help us, as well as the DEC, is critical to any long-term and comprehensive approach. And I think that we have a great group with the Environmental Management Council, and we should direct them formally that this needs to be a priority, figuring out what bodies of water are affected, figuring out where the problems are, recruiting PRISM, which is a not-for-profit agency that looks at invasive species and where they are, and attempts to work with to eradicate them where possible. There are resources out there, and I think we need to look to the planning office and the Environmental Management Council to help us find a way.
I think Suzanne was next.
So the DEC in 2017 awarded a grant to Clarkson to work on this exact problem. They worked on it. I don't know where it's at today, but.
That's why we need to.
It's on a shelf somewhere.
We need to be focusing, get these, that's the kind of piecemeal approach that's been going on for far too long.
Mr. Fay?
I just see we're trying to attack individual problems. I said, in the meantime, We've got St. Lawrence County basically putting more of their land and finding the Adirondack Park, buying it up, and I don't think they can manage what they've already got. I think the direction has to start coming from the state. That's obvious.
And I will let you know, I've already talked to Jason about this, and I've already talked to Nicole about this, and I've made a couple of other contacts. And, you know, my feeling is look, it's a daunting task. Pessimists would say good luck, it's already gone wild. I'm optimistic about this. It is on people's minds, at least in my area. And if you take a look at what they just discovered in the Oswegatchie before the dam there in Middleton, I mean, you can walk on it, for God's sakes, it's so thick. And it's widespread. So it's a problem. We need to address it. That's why we're here.
Gotcha. So, sorry, go ahead.
I'd like to echo everything that Mr. Lightfoot was saying. I think I sent everyone an update of what the Sylvia Lake people have been doing to fight this. And they've been fighting it and spending $1,000 over the last 4 or 5 years that I know of. And they continue to, and they've also asked for help, and I probably will be coming up with a resolution, maybe at the next finance meeting, to see if we can do something there as well. It'd be nice to know, it seems to me it should be, as everyone said in here, it's not up to St. Lawrence County to deal with our all alone, at least it's not up to us to solely take care of the problems we have with the water. You would think it would be a statewide drive to make sure that lakes in the state of New York are desirable for recreation and tourism. And so it seems like somebody from the DEC should come and talk to us and tell us why the state has not moved on. I can't imagine why they haven't. And then I can remember, it wasn't more than 5 or 6 years ago, Senator Schumer was up here and held a huge press conference at Black Lake, talking about how he was going to take on the problem up there. And I don't know how well that worked out, but apparently it hasn't worked out that well. But I do remember him being up here and being on television and had a huge group of people there as his audience, and he was aware of it. So it's not just a state problem, it's also a federal problem in terms of who can help us on this. But I guess I'd like to find out from those people who I would think the DEC would have those studies available, all about what the pros and cons are trying to fight this basic species. Maybe their thing is just too cost prohibitive. And if it is, I'd like to know that that's what they feel, and then we'd have to ask ourselves if it's cost prohibitive for the federal government in the state of New York, where I know they like to spend money, then how can we attack it here as a St. Lawrence County? So I'd like to have someone come here and address this body so we would know what they've thought about in the past. I know they have. I can't believe that they've not thought about trying to fix this problem. What are the roadblocks?
Well, I think some of it is we have a lot of land, a lot of water, and not a contact. I agree can we ask somebody from the DEC to
Sure.
come chat with us? One of the articles I found was there are places that harvest the water chestnuts because they're nutritious, high in fiber, low in calories, contain no fat, and are rich in vitamin B6. There are areas that harvest them and eat them and won't. You know, it's like the kudzu. There's people, I was watching a video the other day, and the kudzu is real invasive. Kevin knows about it. It's like this great big leaves everywhere, and they feed it to cows in some parts of the United States now. They put the cows out in the thing to eat it.
Very good.
A kudzu? Really? Oh,
Kudzu?
Yeah, I'll show you the video after, but no, I agree. Yeah. There's all kinds of stuff, but I mean, obviously something's out of balance. So any other?
I would just add to this, I mean, I jokingly called up Mr. Lightfoot after we received the email from Mr. Sheridan and said that my neighbor's pool had milfoil, and by wanting to come forth with a resolution to fund the cleanup. And that's my point. It was a terrible joke. He said he was going to get even. He probably will hear my comments, but every body of water has some type of invasive species. And the method that was approved and voted, I think, 11-4, about cutting it and harvesting it is not the right way to go about it. It just exacerbates the problem. It's a hybrid conceptual, which doubles the growth. Those 2 heads instead of 1. And so if we continue to do that, we'll actually create more of a problem. We don't know the history behind this, what the DEC has done. We realized, that our constituents have a problem and they're asking us to address it. You addressed it, but you didn't. I voted no. I don't think we addressed it in an effective manner. There's a lot of work to be done.
Mrs. Hagan?
Thank you, Madam Chairperson. Would it behoove the chairman of our board to select people who are familiar with this or that have contacts to form a committee so we could concentrate efforts on this instead of having this kind of shotgun approach? I will put that out there.
Mr. Chairman, if you're interested, tell us.
I was thinking maybe the Fish Advisory Board would be the group that would know an awful lot about
Fish and Wildlife?
fishing.
DMC.
Yeah.
EMC.
Yeah, Environmental Management Council. Yeah.
Yeah.
Because we had a discussion about this at the last Fish Advisory Board meeting. Just it's everywhere. I remember in the mid-90s when we did landscaping in Syracuse, the water chestnut was a highly sought after plant to put in people's ponds after you built them. You paid probably $15 a plant to be able to put them in someone's pond. And you paid for those little things that float on top, you paid so much for like a scoop of those.
So that would be a good idea. The Environmental Management Council could look at this and, as you suggested, say,
Thank you.
we'll see to it that that's done.
Thank you, sir.
Ms. Jones.
Just to clarify, when I speak with them, we're focusing on aquatic invasives. So are we starting with that before we get into the much larger scale? Yes. Yes.
We'll keep it secondary.
Yeah.
Okay, thank you.
Yeah.
I'm gonna do first.
And if you have any moves, anybody else have anything? We have a need for executive session?
We do for 2 items tonight, litigation and personnel, for the medical, financial, credit, or employment history of a particular person or corporation, or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, or dismissal, or removal of a particular person or corporation.
Do I have a motion to go into executive session by Mr. Latham, second by Mrs. Hager?